waiting for opportunities to return to the big cities, but others are staying close to home, finding out their skills can be used in other ways, in ways rather they imagine.
Spain's death toll from COVID-19 soaring past China's, now second only to Italy, with more than 700 deaths reported in just one day. An update from Madrid ahead. In Wuhan, light at the end of the tunnel. Bus service resuming in the city of 11 million after 2 months of lockdown and no public transportation.
Live from Washington, this is The World Today.
Hello there. Welcome to CGTN. I'm Mike Walter in Washington, D.C. We begin again with the pandemic now gripping the globe. From India to Italy, the United Kingdom to New Zealand, people are forced to stay home. Daily life as we know it put on hold as governments battle the outbreak. More than a quarter of the world's population is under some sort of lockdown, and more countries are introducing curfews. South Africa's is set to begin on Thursday. Libya is the latest place to record its first case. The North African nation already is hit by fighting and an oil blockade. And as New York City grapples with the worst outbreak in the United States, its police are feeling the brunt of all of this. 9% of the 34,000 strong force called out sick on Wednesday. That's 3 times the average. The biggest economic relief bill in U.S. history has hit a snag, and as cases in the U.S. surge, the White House is announcing even more emergency measures to try and fight this pandemic. Giles Gibson has more from Washington.
We saw a shift in tone from US President Donald Trump in the latest White House briefing from the coronavirus task force. Over the last few days, President Trump has been talking a lot about how he wants to get workers here in the US back to work by Easter, which would be less than 3 weeks away. Now, President Trump is talking about the different ways in which the federal government is supporting different states. Take a listen.
I have now approved major disaster declarations for New York, California, Washington, Iowa, Louisiana, Texas, and Florida. That has great significance, as you know, and legal significance.
Meanwhile, up on Capitol Hill, the Democrats and the Republicans are trying to get a $2 trillion economic relief package through both chambers of the US Congress, but there are 4 Republican senators who are digging in their heels over one particular detail. They have concerns about the expansion of unemployment benefits that's currently written into that legislation. They are saying that it will actually incentivize workers to stay unemployed rather than getting back to work. Now, senior members of their own party are saying that they have misinterpreted the language in this legislation, and the hope is very much still that this legislation will pass through both the Senate and the House of Representatives and make it onto President Trump's desk to be signed by the end of Thursday local time here in Washington, D.C. Giles Gibson, CGTN, Washington.
Spain now has the world's second highest number of victims, more than 700 dying in the last 24-hour period, the highest spike, I should say, in one day. Rahul Pathak has more from Madrid, one of the hardest hit areas.
The President, or Prime Minister, sorry, has been speaking at the Parliament building behind me, and yes, he was asking to basically get his extension plan ratified by Parliament. He's basically asked for the national lockdown to be extended to April the 11th, which means that the Easter holidays is completely, not cancelled obviously, but the Easter celebrations have been put off, and that is a really huge deal in this very, very strong Catholic country. It comes amid a huge spike in the rise of daily deaths here in this country. 738 deaths in the last 24 hours. That is a quite shocking day-on-day increase of 27%. That means Spain moves past China and just behind Italy in terms of the amount of deaths globally. And there's an interesting comparison between Italy and Spain. In Italy, the coronavirus death toll, although very, very high and shocking, has been confined, relatively speaking, to northern Italy, whereas here it's spread all across the country. The territorial spread is far, far greater here in Spain. A lot of people have been travelling around the country, and that has clearly had a large impact on the huge spike in new cases around the country, and unfortunately the rise in the amount of people dying from the virus here. In terms of the actual restrictions, they are staying the same. So people have to stay at home and can only leave their home if they're going to and from work or if they need to buy essential food or medicine. Airports and stations remain open as for now, but at a severely restricted level. But there is a debate here about the level of restrictions and whether the lockdown should be more strict. Opposition parties have called for a stricter lockdown, more in keeping with what Italy have done. There was the leader of the PP party, the Popular Party in Andalusia, has asked for a full lockdown, and she was quoted as saying we should fully stop the country, just leave essential services. At the moment, the government is sticking with the level of restrictions they have at the moment. They might have to reconsider that if the figures of deaths and new infections don't start leveling off.
That again was Rahul Pathak reporting. With each passing day, more and more aspects of life in Wuhan are returning to normal. More than 100 of the city's bus routes are rolling again. Passengers and residents alike say it's a positive sign, but one that comes with some extra responsibility. CGTN's Tong Bo reports.
Getting ready to hit the road. After a more than 2-month suspension, Wuhan's bus companies restored operations on 117 of their routes Wednesday morning. They account for 30% of the city's total bus transport capacity, according to the Municipal Transport Bureau.
Today is my first day taking a bus in 2 months. I'm excited. Buses have resumed their services. It's a new day for the city.
However, passengers have to go through special boarding procedures.
To take public transportation like buses or subways, passengers need to scan this code when they get on board. Then they will have their body temperature checked and scan the code again when getting off. This is part of Wuhan's public transit real name registration system, which enables bus companies to track all their passengers.
However, figuring out how to register quickly is not easy for some elderly passengers. Therefore, each bus has a security official on board to help them.
Security officials have another set of different codes. They will use their own mobile phones to scan codes for the elderly people and help them register.
Wuhan is still under lockdown, and risks of spreading by sporadic and imported cases still exist. But many passengers say seeing buses back in action gives them hope that Wuhan will soon get back on track. Tang Bo, CGTN, Wuhan, Hubei Province.
The United States does not have a universal health care system. Instead, it relies on a combination of private and public health insurance programs. Now, the response to the COVID-19 pandemic has raised some questions about the nation's health care system. CGTN's Roy Ruttenberg investigates.
This week marks 10 years since then U.S. President Barack Obama signed into law his signature Affordable Care Act. Dubbed Obamacare, it was meant to provide access to health care for all Americans. A decade later, millions don't have coverage.
And that's a huge concern in the middle of the coronavirus, right? Because this is a pandemic. It doesn't hit just people who are insured.
Emergency legislation now guarantees that COVID-19 testing for all Americans is free, regardless of health insurance status. But that guarantee doesn't apply to subsequent care. And many Americans who are insured are still unsure of how to get tested. Critics say Washington fumbled in its rollout of diagnostic tests for COVID-19, delaying by weeks the deployment of kits to communities across America.
There is no central entity in the U.S. that makes policy decisions for the whole healthcare system in our country, which makes dealing with an epidemic like this extremely complicated, much more difficult here than in places like South Korea or China.
The Trump administration has largely deferred to state authorities on healthcare matters, offering, quote, federal support. But several state governors have complained they're getting little to no guidance.
Sometimes we have decisions made at the federal level that might conflict with decisions that are being made at the state and local level.
U.S. President Donald Trump faced backlash for appointing his deputy, the vice president, and not a medical professional to lead the national coronavirus response. But Trump's defenders say the president overall has acted correctly and swiftly, with Trump in mid-January introducing health screenings at major U.S. airports, and by the end of January, banning entry to the U.S. of some foreign passengers, a list that later expanded. But was it too little, too late?
One of the reasons we're seeing this huge spike in cases is we were not prepared. We didn't make the investments that we needed to make in public health. Underfunding of public health is a long-standing problem.
These are the people empowered to change that.
They ought to be embarrassed, Mr. President.
But on Capitol Hill, for weeks, lawmakers have been blaming their political foes for the crisis, while trying to rally federal funds for struggling states. The president insists he'll continue his efforts to repeal Obamacare. The Supreme Court this month announcing it would hear the case. Trump still hasn't spelled out what he'd replace it with. Health policy experts warn such ambiguity only leads to chaos and confusion at a time when clarity and order are so desperately needed. Roby Ruttenberg, CGTN in Washington.
Coming up, Brazil's tightly packed favelas. They could quickly become a COVID-19 hotspot, and that has residents scared. We'll take a closer look after the break.
No one again began holding guns. Machine guns from police forces toward the protesters.
Were you worried about your life at that particular time?
Not at all.
What is your assessment of the state of the continent today?
Africa has the potential to power itself.
Excuse me.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.
Riot police in Kenya resorted to using tear gas to close down a market as they moved to enforce government rules to prevent the spread of coronavirus. Traders and shoppers scattered. One trader suggested the government should pay people to stay at home and not to go out. More than 11 million Brazilians live in favelas, about 1.5 million in Rio de Janeiro alone. The city's lockdown, it's the poorest residents who fear the coronavirus outbreak the most. Lucrecia Franco reports.
Rocinha is considered Brazil's biggest favela, with a population of 70,000, according to the latest census. People here are bracing for the worst.
Então, uma coisa a gente vivenciar a situação do rico.
It's one thing to face the coronavirus if you are rich. It is another thing to live up on a hill in a crowded shack and inhumane conditions.
William Oliveira, a community leader, is now asking for donations because he says most people are informal workers and are running out of basic goods. A closer look at the hillside community with its narrow alleys lined with makeshift homes illustrates just how hard it will be to stop the virus from spreading. Many of these dwellings house 8 or more people, with sometimes 5 or more for a tiny bedroom. Isolation is not an option. People are trying to stay inside and follow public health recommendations, but some are worried about how much the virus may have already spread.
We are out on the streets without knowing who is infected or not, because nobody is going to say, I have it. So people are feeling lost.
So far, no cases of the virus have been registered in Rocinha, but it has been detected in other favelas. This is maybe one of the worst case scenarios for Brazil's health officials. COVID-19 spreading among the most vulnerable and dense populations, where avoiding getting contaminated is almost impossible. Many people here work in the informal sector. They have no savings and will be in a desperate situation soon. The government has responded with an aid package of about $40 per month per worker.
São muitas pessoas vivendo os mesmos temas.
Too many people have the same problems, struggling for food and to stay clean, to pay rent, and are now facing unemployment. $40 is not enough.
For now, Rocinha is quiet, but with no income to live through a prolonged lockdown and without the means to fight the coronavirus, many fear a collapse of the social order could be an even bigger problem than the pandemic. Lucrecia Franco, CGTN, Rio de Janeiro.
Australia and New Zealand are increasing their efforts to slow the spread of the coronavirus. Both countries have closed their borders and are urging people to stay at home as the number of confirmed cases continues to rise. CGTN's Greg Navarro has more.
The steps to one of Sydney's most recognizable landmarks are noticeably empty. So are ferries and trains in a city visibly impacted by measures aimed at slowing the spread of coronavirus.
No more going to the pub after work. No more going to the gym in the morning. No more sitting down for brunch at a cafe. These changes are vital to slow the spread of this virus to save lives.
But there seems to be some confusion over what people are and aren't allowed to do, what businesses can remain open, prompting one opposition minister to describe the latest restrictions as being as clear as mud, and forcing the Prime Minister to again clarify exactly what those new measures mean.
There's also growing evidence that some people aren't heeding the warnings. Days earlier, Bondi Beach was packed despite repeated calls for social distancing.
What we saw this morning here in Bondi Beach was the most irresponsible behaviour of individuals that we've seen so far.
Bondi and other beaches were closed the next day, and a ban on cruise ships from foreign ports hasn't stopped them from coming to Australia. One ship docked in Sydney earlier this month and let passengers off before testing for the virus was completed. At least one passenger has died, and dozens of people who were on board are now confirmed to have the disease. The bans on social gatherings and non-essential services have forced many businesses to stop trading and prompted thousands of people suddenly out of work to endure long lines for government assistance. This group of musicians gathered to highlight the uncertainty facing workers in the country's arts sector.
These are people in insecure work who will have no capacity to pay their bills, to pay their rent, to pay their mortgage.
Australia has now banned all overseas travel. Domestic travel has been severely restricted, and students across much of the country have been told to stay at home. Neighbouring New Zealand has also closed its borders, announcing a total lockdown to slow the rise in cases.
To be absolutely clear, we are now asking all New Zealanders who are outside essential services to stay at home and to stop all interaction with others outside of those in your household.
New Zealand Prime Minister Jacinda Ardern defended the measure, saying the worst case scenario would represent the greatest loss of lives in the country's history. Greg Navarro, CGTN, Sydney.
The United Nations is launching a global humanitarian response to fight COVID-19 in the world's poorest countries. More than $2 billion will be spent to help people in South America, Africa, the Middle East, and Asia. But there are concerns restrictions meant to protect staff could actually hamper their work. Sarah Walton has more.
COVID-19 has now been reported in nearly every country across the globe. And as it begins to spread more rapidly in the developing world, the concern is that countries with less well-funded healthcare systems and fragile economies will be the most severely impacted. The UN says it will focus on fighting the virus in the poorest countries.
We must come to the aid of the ultra-vulnerable, millions upon millions of people who are least able to protect themselves. This is a matter of basic human solidarity.
UN agencies and international NGOs will help deliver laboratory and medical supplies, install hand-washing stations in camps and settlements, and launch a public health information campaign. It's estimated the project will cost more than $2 billion, and wealthy countries are being asked to contribute.
We're seeing huge economic
stimulus plans being developed around the world, and that's going to help. But it would be a smart strategy and an intelligent strategy for every developed country just to spend a little bit of their money on dealing with this problem in the most vulnerable places as well, because that is part of what you need to do if you want to protect yourself.
But the UN itself is now having to make adjustments to keep staff safe. The headquarters in New York is closed to all but essential workers, and the Security Council has cancelled some meetings and experienced technical glitches as it tries to continue its business over video conferencing. There are concerns the UN's effectiveness might be limited.
The importance of the UN is that it's a place where diplomats from around the world can come together, particularly from those countries that have fewer diplomatic resources. And so it might be possible for the United States and the United Kingdom and China, for example, to be having multilateral relationships. That's not necessarily as possible for maybe a country like Ghana or Suriname.
Some aid workers have been evacuated from host countries, while others have been affected by travel restrictions. The UN says it has issued new guidelines for staff and is asking the private sector to help provide enough masks and protective clothing.
Officials are currently planning for this humanitarian response to run until December, but they say it is difficult to predict how this virus will spread and affect people's lives across the world in the months ahead. Sarah Walton, CGTN, New York.
Coming up, life in small-town America. It's usually pretty quiet, but with the outbreak of COVID-19, residents in a Kentucky town thought the worst. We'll show you what happened next.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
We are CGTN, China Global Television Network.
The coronavirus outbreak has so far been concentrated in major cities across the United States. For the most part, the impact on small-town America has been minimal. But as CGTN's Sean Caleb's report from Kentucky, small towns tend to be tight-knit communities with a fighting spirit.
Take a look at all this butter and sugar. It's no surprise that Robert Vella's motto is "Don't trust a skinny chef." But you might consider it a surprise that this small-town restaurant is holding its own in the middle of a pandemic.
We thought for sure when the announcement came and that we were done. Our life dream, our retirement that we poured into this was all done, and this town said not today.
Like all other restaurants, Nola's only offers curb service, but it seems nonstop. This is Cynthiana in Harrison County, Kentucky. Population 6,300. COVID-19 didn't strike first in a major city in the state. Instead, it hit here. Becky Barnes is editor of the Cynthiana Democrat and has worked here 44 years.
I've always felt like we were a compassionate community, and this has just brought all that home to me.
With help from local government and county health leaders, the Democrat did what small newspapers do best: get important information out quickly to every single person in the county. No names are being released, but residents are rallying around the handful of people who are struggling with the virus.
People know, in a small community, people know who they are.
Things like this can have one of two effects. It can pull you apart or it can pull you together.
James Smith and his two partners refurbished and reopened the downtown Rose Opera House a dozen years ago. Smith is also the Cynthiana mayor. The theater pops popcorn on some nights. Rose is closed for films and plays, but residents can drive by and pick up a movie staple to enjoy at home. Smith's goal is to lead by example.
We can show the rest of the nation how to handle something like this that has the potential to tear you apart, but really has the opposite effect on it, pulls you together.
This is the main retail drag in Cynthiana, Kentucky. All these shops are open. Usually this time of day, shop owners say there'd be lots of foot traffic, people going in and out of the various stores. But COVID-19 has changed all of that. And the big question is, how will Cynthiana and the rest of small town America weather the economic fallout from this ongoing pandemic?
It's scary because, things have slowed down some.
4 years ago, Stacy Eckler opened her boutique in Cynthiana. Right now, like most others here, she is fighting through one day at a time.
You do worry about whether or not you're going to be able to keep your doors open.
A lot of the small shops, it's their dream, and they don't have 6 months of reserve cash to get them through.
As long as they push through it, we'll, on the other end, we'll grab their hands and pull them on.
And for the time being, that is a lot more than other towns and cities have right now. Sean Caleb's, CGTN, Cynthiana, Kentucky.
The coronavirus pandemic is inspiring street artists around the world. A 16-year-old in Athens is using the roof of his apartment building as a canvas. He's painted a mural with images of the coronavirus and a simple message: stay home. The young artist uses the roof since Athens is under a lockdown. And a street artist in New York who calls himself De Grupo is also sending a message. He's posting signs around the city with messages like wash your hands and stay home.
I'm just trying to make sure that people get the message and not socialize, not kind of interact with each other, the necessary, but I don't know. I feel like the art needs to be communicated. It needs to say something right now.
De Grupo says he's been practicing social distancing for weeks, only leaving his apartment to post a new message to his fellow New Yorkers. And finally, some creative confections in Switzerland. A bakery in Bern is selling specialty chocolate Easter bunnies, each wearing a protective face mask. It reflects the safety measures being taken as the world deals with this coronavirus pandemic and comes just in time for the Easter holiday. Store officials say the sweet treats are a hit with their customers. And that is The World Today. Thanks so much for watching. I'm Mike Walter in Washington, D.C. China 24 coming up next. And for more news, anytime, check out our website. You see it there at cgtn.com. Coming to you from Washington, D.C., this is China 24, our look at China and its impact around the world.
Using technology to make sure cases of COVID-19 stay on a downward trend. We'll show you how China is using QR codes in the coronavirus fight. And ready to get back to work. Lockdowns left many migrant workers stranded in their hometowns. Now they're finally starting to head back to jobs in Hubei province.
Live from Washington, this is China 24.
Welcome to our studios here in Washington, D.C. I'm Mike Walter. As more parts of China begin lifting restrictions put in place to combat the coronavirus, the country is reaching out to help the rest of the world in the fight against this pandemic. CGTN's Zhao Yang joining us from Beijing with more on this.
Hi, Mike. Chinese President Xi Jinping plans to join other world leaders for a G20 virtual summit on COVID-19. Saudi Arabia will be hosting this video conference on Thursday, and leaders are expected to discuss the pandemic and the social and economic impact that it's having around the globe. President Xi is expected to call for increased global cooperation and coordination.
The G20 is an important platform for global crisis response and economic cooperation. It played an important role in dealing with the 2008 international financial crisis. At this critical juncture, the international community expects the G20 to play its leading role once again. The special summit will be the first video leaders meeting in the history of the G20, which is also an important opportunity for all parties to discuss how to take common actions.
President Xi has also been talking to G20 leaders individually. On Wednesday, he spoke with the German Chancellor Angela Merkel. And China is, as you say, offering supplies and medical advice to countries struggling with coronavirus outbreaks. A team of doctors from Fujian province departed for Italy on Wednesday. And they are the third medical team from China to make that trip to Italy to help doctors and nurses trying to get ahead of a surging infection rate. And supplies are also bound for other parts of Europe. A train loaded with protective suits and more than 100,000 masks is headed for Madrid. Spain is also struggling to control its outbreak. And both Spain and Italy have now recorded more COVID-19 deaths than China. Mike.
Zhao Yang live for us in Beijing. Thanks so much. Well, China has recorded 67 new COVID-19 cases with 6 deaths. All of the new cases are people returning from overseas. Now, the government is warning against a new rise in infections. Stricter testing and quarantine regulations are being imposed in gateway cities like Beijing and Shanghai. CGTN reporter Yang Chengqi explains how a new system in Shanghai processes international arrivals.
This quiet neighborhood in Shanghai is China's new defense against COVID-19. With most new infections coming from international travelers, the government has set up testing zones like this. It has been in place since March the 17th. Every day, about 200 travelers flying in from hot zone countries are ferried here straight from the airport by city buses, now turned into specialized coaches.
The airport staff have been very patient to explain the process. We had our temperatures taken, information filled in, and we went through different lanes based on where we flew in from. Then we're brought here to the testing zone closest to our home.
Their biosamples will be taken by the staff here for testing. Then they'll be checking into a designated hotel and wait for the results.
We haven't met our maximum capacity yet. We have 320 rooms available. I think China is better medically equipped against the virus, so we came back for safety.
Staff closely monitor which room has been sanitized. Other measures are put in place to reduce the chance of cross-infection. Even couples cannot share one room.
This is a matter of principle. I'm afraid we cannot compromise. We know that taking care of a baby is tough. We provide diapers here. In the meantime, we will also give her the approximate checkout time so she will have some sense of certainty.
The policy here is one person, one room. From here on out, all their daily necessities like food and toilet paper will be hand-delivered by the staff here.
The goal is to make sure that they don't leave the rooms at all until the test results are out.
While they wait, their biosamples are sent every 2 hours to a testing facility nearby. KingMed Diagnostics has been the test provider for Wuhan's Leishenshan Hospital. After these samples reach their 24-hour lab, results can be expected in as little as 4 hours.
We've decided to raise costs to quicken the process. It would have been most cost-effective to wait for 90 samples and test them collectively. But now we test as soon as they come, no matter how many samples they send in.
With a more expedited process, guests can now leave the testing zone within 24 hours. While those who test positive will be sent to hospitals, others will proceed to a 14-day home quarantine. Yang Chengxi, CGTN, Shanghai.
An app that monitors your health condition has been widely used in China during the pandemic. It generates a health QR code, which travelers are required to use as a pass. CGTN's Mike Fox has more details on it.
While the global battle against COVID-19 rages on, China is in for some long-awaited good news. Authorities plan to end Wuhan's lockdown on April 8th. Transportation in and around the city is starting to return to normal as people venture outside more and more. But residents are required to register an online mini-program on their phones to get their health QR codes, and only those with green codes will be able to walk around freely. So what exactly is this QR code? Launched by Chinese app Alipay on February 11th, the QR code system aims to track people's real-time health conditions and information related to the epidemic. Days later, the system was promoted nationwide and now covers the entire country. According to news agency Xinhua, it was put into use in over 100 cities within a week. On Wuhan City's specific mini-program, we can see what information the system collects from people. Apart from personal information, it needs to know your health condition, if you are healthy or running a fever, or if you recently recovered from the coronavirus. Also, whether you have connections with any confirmed cases. Now people can easily get their codes on WeChat or wherever mini-programs are provided. They can use the code as a pass together with their IDs to enter or move around the city and communities. It uses a red, yellow and green system, with green meaning you're good to go. The QR code can be a necessary guarantee to protect citizens from potential danger, especially at a time when China is returning to work cautiously. Mike Fox, CGTN.
Joining me now from Shanghai is Steffi Noel. She's project leader of Dashiell Consulting. And why don't we start there with these QR codes, Alipay? I mean, there's some interesting businesses that are actually coming out because of this pandemic, right?
Yes, of course. Yeah, we can mention everything related to e-commerce, for example. So delivery services, especially food delivery services, as people didn't go out to restaurants anymore. And also everything related to online entertainment. So we can mention social media and influencers, of course. For example, the traffic on Douyin, which is a Chinese TikTok, has more than doubled for some accounts. And like they are, for example, online sports platform, remote work and study platform that are very popular right now. And of course, not to mention the video game industry, for which the pandemic is kind of a blessing. And among all of this, the big new tech trend to follow is live streaming, which is extremely popular right now.
Steffi, you know, it's interesting. I was in China back in December, and, you know, I went to pay, went out with a colleague, went to pay. He's like, you know, we don't pay that way. He pulled out his phone. I mean, that's a common way. And in some ways, it seems as though China was more equipped to deal with this pandemic. I mean, when you look at the QR codes on the phone and the capabilities that people have, it's a little bit different than here in the West.
I think we can mention some differences. The first one is, of course, Chinese people are more used to digital apps, and everything is digital. So when it comes to remote work and using your mobile phone to entertain, to pay, to everything, people are more used to it, even old people. While in the West, for old people, it will be very hard to be confined. So this is the most difference, I think.
And Steffi, looking, at the situation right now, a lot of these cities around the world in lockdown. What about businesses like Zoom setting up these meetings online? So many people now working from home. This getting the collective, the team together. What about these types of industries flourishing as a result of the pandemic?
There are a lot of new applications to do remote work and meetings, business meetings in China now. And what we can notice is that some of them that are the main players in the market, they are offering free services for all the businesses, like WeChat for businesses, like WeChat for work is now totally free for businesses, which is a great opportunity for businesses in China, which are very impacted by the virus, of course.
Steffi, let me ask you about small businesses, because we're hearing a lot here in the United States about how these companies may not be able to survive without a government lifeline. What about there in China? Did smaller companies figure out ways to adapt? How did they fare?
So, yeah, of course, medium-sized and small businesses will be impacted. The impact will be huge because the operating activity is almost stopped and now it's hard to recover. So for small businesses, they struggle to make payments on loans, and they will stop everything related to investment and new projects to focus on how to survive. And this is also the case for small factories, which are like very big impact for them, as they have a very small financial cushion and the management is less stable for crisis. And this will impact China's global economy as well, as because like small and medium-sized businesses make up over half of the China's economic output. But now they are all trying to focus on how to survive with cutting investments and new projects.
Yeah, it's going to be interesting to watch how all of these countries come out of all of this. Steffi, thanks so much for your insights. Really appreciate it. Cities in Hubei are getting back on track as things are easing in China. For one of the worst hit cities, how it's like on the first day after the lockdown is finally lifted.
You've traveled to places where others couldn't be, seen things others couldn't imagine, and heard stories you can't be sure whether to believe. They say that you're privileged, that people look up to you. But only you know how much effort you've made. You're on the ultimate journey to discover a country with 5,000 years of history and nearly 1.5 billion people. Is it a green countryside or a vast sea of neon lights and skyscrapers? Is it a dangerous land choked with smog or the blue sky of a summer's day? What is this China for you? And what is this China for the rest of the world? CGTN. See the difference.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.
We are CGTN, China Global Television Network.
China is lifting traffic controls in cities throughout Hubei province. The capital, Wuhan, is excluded, but another hard-hit city in the eastern part of the province is resuming normal transport. CGTN Sun Tiyuan takes us there.
Honggang used to be one of the worst-hit COVID-19 regions in Hubei province, and on Wednesday, the city announced to lift its 2-month lockdown. And this has been a long-awaited moment for many people who were stranded in the city. Honggang Huan's traffic department says the city has opened its highway today and at least 2,000 vehicles have left Huanggang this morning. And the city's train stations have partially opened business today. This morning, a train carrying 1,100 Hubei workers has just left the city to southern China's Shenzhen. And according to the station, this is the third special train they arranged for these workers to continue work outside Hubei. As the overall situation eases in Hubei province, Huanggang is gradually resuming industrial production and business operations. Residents' daily lives are also getting back on track. Experts believe the latest measures have sent a positive signal to local people that their lives are getting back to normal once again. And some locals told me they believe the outbreak will be over very soon. Sun Tianyuan, CGTN, Huanggang.
With Hubei's lockdown coming to an end, migrant workers there are able to travel back to the cities where they work. They've been waiting for this for 2 months now. CGTN's Omar Khan shows us what that journey is like.
然后2、3个月没上班，其实老实说也挺想上班了，然后就目前的感受是这样。
For that 24-year-old migrant worker, returning to Guangzhou has been a second homecoming. Today marks a week since trains from Hubei province resumed trips to southern China. This train, which came from Huanggang City, is a charter route carrying migrant workers.
所以我首先要对他们表示一个感谢。
I want to say thank you. I feel really grateful of the government for arranging a charter for us. We can get back to work.
2 months ago, this train station was deserted, with few opting to travel at the height of the epidemic. But this past week, a completely different story. And though many people here may be pleased to come back to work, the journey back had all the elements of China's strict preventative measures.
一般的，我们首先要进行
Before getting back, everyone was required by the government to go through a few procedures. Once they were all done, we could enter the station. Then after our temperature checks and security checks, we're able to get on board.
Meanwhile, transit authorities in charge of receiving people from Hubei province have also played their part in keeping everyone safe.
Now, Guangzhou South Railway Station is at Platform 1 for receiving all passengers from Hubei. We sterilized the platform, elevators, magazines on the train, and all equipment at a higher frequency. We also added 20 extra infrared thermometers at the exits to make sure all passengers have been screened.
Going forward, Guangzhou has arranged chartered trains and buses for some 10,000 migrant workers across China. Nearly 1,900 workers from Hubei will also finally have a way to get back to work and perhaps to a sense of normality. Omar Khan, CGTN, Guangzhou.
For many in Wuhan, it has been a grueling time. Straight ahead, the story of one family with a young daughter who just wanted to eat with her mom and dad once again.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there. To see, discover, explore. We put the pieces together to find what really matters to you. All around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
Hello everybody, I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week, we take a deep dive on world headlines, talking to experts, journalists, and others. It's a fresh, focused, and intimate look at the issues that matter most. Whether you're at home or on the go, you can find the Heat podcast just about anywhere podcasts are found. Have a listen today and subscribe. Thanks.
We are CGTN, China Global Television Network.
Wang Chunwei was one of the first patients admitted to Wuhan's temporary hospital. He posted a series of videos from inside the hospital to encourage other patients. Behind the camera, he and his family have been going through some very tough times. CGTN's Wang Yichang has the story.
This is the 50th day that this family has had to eat separately.
给你了几块胡萝卜，然后有羊肉，然后还有一个鸡蛋。我们家闺女在房间里已经待了好长时间了，是吧？这就是她自己的卧室，她就天天就是待在床上就不下来。
一切都好了以后，最想跟爸爸妈妈一起做的事儿是什么？
一起吃个饭。
自今天10时起，全市城市公交、地铁
那天是大年30，我跟我妈那天下午打电话一起，我妈当时就提了一句说，她好像有点发烧，我就愣了，你知道吗？因为我们都知道发烧是后果是什么，因为已经传得很厉害了。家里每个人一量，我发烧了。
It was the first time their family had to eat separately while living in the same room.
我老婆一边吃就一边哭起来，然后我们家闺女呢，本来在吃的，然后也放下筷子，然后去抱着她妈，俩人一块哭。
After one tested positive for the disease, he had to wait at home due to the lack of beds in the hospital. His wife got some milder symptoms, but still had to care the family.
每天我都这样子吃，然后妈妈过一会儿就会把碗收走，就是因为如果是我自己开的话，有可能他们就有细菌。人家跟我开水龙头之类的，就觉得很麻烦。哎呦，每天上厕所都要这样子搞那样子搞。
我这边呢，我也很累，我要让我自己好起来，我不能倒下，要帮他做好消毒。一个想法就是，孩子不能有事。
火神山和雷神山医院是两所新建的医院。
The construction of Huoshengshan Hospital was completed when Wan's illness got more severe, and he was among the first group of patients admitted to the hospital.
这里就是火神山，我们可以来看一下，这里的条件都还是相当不错的，看见没？
Wan started to film his daily life in ward to encourage more patients, but it was a tough time for his family.
爸爸去医院了以后，是又害怕又伤心，然后每天晚上就在这边一边哭，然后一边想爸爸什么时候才能回来。
像这么小的小孩，他一个人在一间房间里一个人，他觉得很无聊。晚上睡觉一个人睡，他也有点怕。到最后他受不了了，我要出去，我要去找爸爸。爸爸什么时候回？说这个病很危险，我说你在家乖乖的，治好的话，爸爸就回来了。
落实4类人员分类集中管理措施，应收尽收。
Not long after Wan got sent to hospital, Wan's wife and daughter was sent to isolation hotel.
他自己背自己的书包，自己提自己的箱子，就抱跟我一起啊，东西在他的机我们的车上面。那个时候感觉他突然长大了的感觉。
因为想等我搞完隔离之后回来，应该就可以见到爸爸了。
嗨，开心呐！今天真的开心啊！我们真的胜利了，真的赢了。
After weeks of treatment, Wan was discharged. His wife and daughter were still in isolation, but he knew it wouldn't be long before they were reunited.
走。那天中午知道爸爸已经到家了之后，我就一直的问妈妈：“妈妈，我们什么时候才能回去呀？”那么结果那天晚上终于可以走了。
妈妈，是你吗？我们有多久没见了？有1个月了吧？你和妈妈都好吗？
但是我很不好。
你为什么不好？我也很想你，但是爸爸现在我们还不能见面，因为爸爸的隔离期还没有结束，我们再等一段时间好吗？妈妈也回来了，很好很好，我们家3个人，1个都没有少。
小家伙，他想爸爸回来可以见面了呀，结果还是不能见，当时就哇，哭得稀里哗啦的。
After Wan being quarantined in his own room for 15 days, he went for a blood test.
拿到检测结果了之后，医生就告诉我，检测合格。
第一件事是做什么？
我出去到我们家闺女的房间里去。
抱的时候，我也不记得自己到底有多少天没有见过爸爸了，特别的激动，就是我感觉心跳都快加快了，因为我等了这么多天，终于等到了这一天了。
But the mother was still worried that herself wasn't fully recovered, so her daughter remained isolated in her room.
就是我们以前我就坐我现在的位置，然后妈妈就坐在那边对面，然后闺女就坐这儿。我们现在没有那么多要求，就一个活命。
现在呢变成了这样子吃，感觉特别不习惯。但是现在慢慢的就开始适应嘛，必须得适应现在有这个病毒的这个生活了。虽然感觉有一点不满足，但是我们家人能团聚就已经很不错了。
我们以前一家人的生活非常满足，非常悠闲，突然打破了。
是啊，我都快忘记以前怎么生活了。所以感觉以前的生活还是更好一点。我希望呢，等这一切都变好了之后，我和爸爸妈妈就在一起，坐在一张桌子上，一起吃个饭。
现在还在一起吃饭，你把他们吃饭，昨天晚上1个月马上都去了。
Our family is fine. Thanks so much for watching China 24. I'm Mike Walter, my colleague Li Dongning up next with World Today Live from Beijing with live coverage of a news conference by the Chinese State Council. We're expecting an update on China's efforts to fight the coronavirus.
This is CGTN, China Global Television Network.
Good morning and welcome to The World Today on CGTN. I'm Li Dongning in Beijing. Well, let's begin with the latest numbers on the coronavirus pandemic. More than 460,000 people have been infected in over 170 countries and regions. Europe and the United States have seen their cases surge. Italy has the highest death toll in the world, with more than 7,500 killed, and over 74,000 people have been infected in the country. And Spain's death toll has overtaken China's, with over 3,600 losing their lives. And the country now has over 49,000 confirmed cases. The United States has reported more than 12,000 new cases, bringing the total to over 66,000. Iran has reported over 2,000 deaths. And on the Chinese mainland, there are no reports of new domestic cases, but 67 imported cases have been confirmed in 13 regions, and that includes 6 in Beijing and 18 in Shanghai. In Hubei province, where the outbreak began, active cases have dropped again to less than 3,500. Nearly 400 patients were discharged from the hospital on Tuesday, and 6 more deaths have been reported. And Chinese officials are briefing the media on the latest on the pandemic. And today's focus is the cooperation between China and the international community.
We'll also answer your questions. Now some opening remarks from Vice Minister Xue, from Vice Minister Luo. Good morning, everyone. Today, I'm very pleased to attend this press conference and give you a briefing on international cooperation against COVID-19. Facing the sudden outbreak of the epidemic, President Xi Jinping is personally taking charge of our nationwide response. He's leading the people to race against the time to beat the virus. Thanks to our painstaking efforts, the situation in China is steadily turning for the better, with life and work returning to normal at a faster pace. This once again reflects the strength of the CPC's leadership and the system of socialism with Chinese characteristics. On such basis, we have curbed the spread of the virus at home and also bought time, gained experience, and offered help for the international fight against the disease. While leading the Chinese people's efforts, President Xi has also attached great importance to the international efforts and directed our work in international cooperation. He had meetings and talks with Cambodian Prime Minister, Mongolian President, Pakistani President, and WHO Director General. And through telephone diplomacy, President Xi and 22 heads of states and international organizations had 26 phone conversations in 2 months. He sent messages of sympathy to leaders of UK, Italy, France, and Spain. And he replied to letters from international friends such as Bill Gates. Tonight, he'll also attend the extraordinary G20 Leaders Summit. President Xi pointed out clearly that the international community must step up cooperation and foster synergy to combat the virus. And the international community has truly felt the Chinese leaders' commitment to cooperation and public good. Premier Li Keqiang talked to German and EU leaders on the phone. State Councillor and Foreign Minister Wang Yi had phone calls with 40 political leaders for 57 times. Love transcends borders. When China was in major difficulty, the international community gave us very valuable support. Over 170 leaders of states and over 50 heads of international and regional organizations expressed support and sympathy to our leaders. 79 countries and 10 international organizations provided assistance to the Chinese people. As we are seeing light at the end of the tunnel at home, the outbreak is occurring in multiple other countries. Now Europe is the epicenter. The US faces a severe situation. Asia's situation is not good either, and the virus has already spread to Africa. Regarding China, for every kindness we've received, we will return many times more. We fully understand the difficulty of others and have provided assistance to the best of our ability. The Chinese government has announced that we provide 83 countries and international organizations such as WHO and African Union with emergency assistance, including testing regions and facial masks. We've also donated $20 million to WHO to support its international cooperation efforts. Our subnational governments, companies, and private institutions are also helping severely hit countries. We've also shared experience with others, such as providing them with prevention, control, and diagnostic plans in multiple languages, holding video meetings, including meetings between experts in the health field. We've also sent medical teams to Iran, Iraq, Italy, Serbia, and Cambodia, and work together with others for the R&D of vaccine and medicine. With China's initiative, a China-ASEAN Special Foreign Ministers meeting was successfully held in Laos. China, Japan, and ROK had a Special Foreign Ministers meeting through video link, and China and ROK also set up a cooperation mechanism for response to COVID-19. China's goodwill and concrete measures have been applauded by the international community. Serbian President Vučić and Hungarian Prime Minister Orban came to the airport to personally welcome Chinese medical teams and assistants. On his social media account, Cambodian Prime Minister broadcast live the Chinese medical team's arrival in Phnom Penh, which was watched by 600,000 viewers. Italian Prime Minister Di Maio said that the Chinese medical experts and medical supplies will save Italy. WHO Director General Dr. Tedros said that what China is doing is right. That is, we need solidarity, and solidarity. UN Secretary General Guterres told President Xi that the UN appreciates China's assistance to countries in difficulties. China's support for multilateralism is vitally important, and he looks to China's leadership in international affairs. Now, COVID-19 is still spreading. Preventing case import has become a priority in our efforts. In a globalized world, mankind enjoy converging interests, shared responsibility, and great interdependence. As President Xi mentioned, a virus knows no borders, and it threatens everyone. COVID-19 once again shows that mankind are a community with a shared future. China will continue to work towards the vision of a community with a shared future for mankind. We will step up cooperation with the people of other countries for the final victory of the battle against the virus. We hope and believe that common peace and shared prosperity will be realized at an early date. Thank you.
Thank you. Now we would like to give the floor to Minister Xu. Ladies and gentlemen, good morning.
长期以来对科技工作的关注和支持。疫情发生之后，中国科技界坚决贯彻落实习近平主席的指示精神，成立科研攻关组，围绕人传救治与用疫苗
We established a number of task forces with focus on clinical treatment, medicine, vaccine, source and transmission route of the virus, testing kit and facility, and animal model. And our goal is to make sure that we can trace it, treat it, prevent it, control it, and prevent it. With all our hard work, we have identified a number of deliverables. We identified the virus strain and shared with WHO the genome sequence of the virus, which is an important foundation for the development of medicines, vaccines, and other therapeutics. We deepened our understanding of the pathogenesis and the transmission dynamism of the virus. We also identified a number of effective medicines such as chloroquine, favipiravir, and Actemra, and some herbal medicines. We also developed plasma therapy, stem cell therapy, and artificial liver therapy, which can fit patients of different stages. We also developed a system of testing technologies such as nucleic acid test and antibody test. These are becoming more accurate and convenient. We're also developing the vaccines, and the recombinant adenovirus-based vaccine entered into clinical trial on March the 16th. All this didn't come easily. We thank the science workers, and also these are enabled by the great progress we've made since reform and opening up. And of course, we owe these achievements to the cooperation with the world and experience of the whole mankind. Living up to the vision of community with a shared future with mankind, we enhanced cooperation with our international counterparts. We received many cooperation proposals and advice from our counterparts globally. At the same time, we are also sharing our data, our technology, and approach with the world in a timely manner. Our response has been defined by international cooperation. Now the virus is spreading all over the world, and the virus knows no borders. So our science community will continue to work closely with other countries in the world on response and treatment, share our experience and our technologies so as to provide important science underpinning to international response. And now we would like to give the floor to Mr. Zeng Yixin. Ladies and gentlemen, good morning. With the direction and leadership of General Secretary Xi Jinping, and under the leadership of the Central Leading Group on responding to novel coronavirus outbreak and the State Council Interagency Task Force, the National Health Commission, NHC, have worked closely with the world to share experience and technology and provide assistance to other epidemic hit countries. Our cooperation has been well received globally. First, we proactively shared with the world China's experience in outbreak response. China's approaches, methods, techniques, and the standards have been proven effective by our success in battling the coronavirus. These are very valuable achievements, and we shared with other countries in light of their realities. The NHC compiled the latest documents, a number of documents such as therapeutical scheme and control protocols. We shared with 180 countries and 10 international and regional organizations these documents. And secondly, we enhanced technological exchanges with international experts. The NHC and WHO co-organized a briefing session on sharing China's experience, which was attended by representatives from 77 countries and 7 international organizations. This is available online, and more than 100,000 people watched the session online. Many top officials, such as Director General of WHO, the UN resident coordinator in China, and the World Bank officials held these conferences. We also established knowledge centers and international cooperation experts group, which they provided experience with other countries through video links. These video conferences have been carried out in a timely manner. They are widely participated, and they helped to respond to many of the demands of other countries, which help to align the technologies of us. Also, China dispatched a number of expert teams to other countries to help with their response. They provided experience sharing and advice and consultation on therapeutics and prevention measures. We've sent expert teams to Italy, Serbia, and Cambodia, and we are also going to send more teams to other epidemic-hit countries. We also instructed our medical teams that have been stationed in 56 countries to help their host countries in epidemic response. They provided advice and consultation to the local people and the overseas Chinese living in those countries. They hosted more than 200 online and offline training sessions. The NHC will continue to follow through on the decisions of the CPC Central Committee and the State Council, work closely with the WHO, and share with the international community our experience and our technologies. China will continue to play its role as a responsible country to battle the coronavirus and build a community with a shared future for mankind. Thank you.
Now, Mr. Deng. Thank you, Mr. Moderator, friends from the press. Good morning. Now, COVID-19 outbreak is occurring in multiple places and spreading across the world. Effective international cooperation is therefore a pressing task. Only unity can help overcome the difficulty, and only joint efforts can help defeat the virus. Epidemic assistance is a significant part of international cooperation. China is actively providing assistance to other countries. This is consistent with our principle to pursue shared interests and our vision to build a community with a shared future for mankind. This is what China should do as a responsible major country, or one that was helped by others when we were in difficulty. In addition, helping others can also help ourselves reduce the import risk of the disease. China International Development Cooperation Agency has actively implemented important instructions of General Secretary Xi Jinping and the plans of the CPC Central Committee. We've immediately activated our international emergency humanitarian assistance. We work together with Ministry of Foreign Affairs, Ministry of Health, Ministry of Commerce, NDRC, Ministry of Industry, Ministry of Finance, General Customs Administration, and Civil Aviation Administration. We've made special arrangements, fast-tracked procedures, lost no time in providing assistance. In 4 batches, we have provided assistance for 89 countries and 4 international organizations. Now we are working on the 5th batch of the plan. We have helped both severely affected countries as well as countries with relatively weaker public health system and ability. We've also helped international organizations such as the EU, ASEAN, and African Union. We have provided $20 million of donations to WHO to help relevant countries improve their ability. In terms of geographical distribution, we have provided emergency assistance to 28 Asian countries, 16 European countries, 26 African countries, 9 American countries, and 10 South Pacific countries. In terms of means of assistance, we have provided medical supply assistance and medical technical assistance. The medical supplies include testing reagents, facial masks, protective suits, goggles, forehead thermometer, medical shoe wraps and ventilators, and medical technical assistance was basically taken in the form of sending medical teams. And in addition, a lot of Chinese local governments, companies, private institutions, and individuals have got involved in international assistance. In terms of our assistance materials, our logo is very salient. Our slogan, "For Shared Future," reflects our commitment to international assistance. On some assistance materials, we have seen ancient Chinese sayings, such as "friendship is as solid as gold." We've also seen quotes from French writer Victor Hugo, former South African President Mandela, and even quotes from Italian opera. These words carry the vision of building a community with a shared future for mankind and proves the possibility of building such a community. Our international assistance operation this time is the most intensive and extensive emergency humanitarian assistance operation since the founding of the PRC. It fully reflects the Chinese nation's broad-mindedness and generosity, and our efforts have been applauded by the international community. Leaders of many countries and international organizations express their appreciation for China's much-needed support. Pakistani President Alvi paid a visit to China to thank China's contribution to the world and expressed Pakistan's brotherhood with China. Serbian President Vučić reviewed Serbian translation of the goodwill message on Chinese assistance supplies, also welcomed Chinese medical teams at airport and kissed China's national flag. The Italian Prime Minister had a telephone conversation with President Xi to express appreciation to China. The President of the European Commission, von der Leyen, used English, French, and German to issue a video speech to thank China. A lot of people also gave a thumb up to China online, lit up their cities with red, played national anthems of China in their communities, and say "Thank you, China" on the streets. Now the global pandemic is still spreading, and China is at a crucial time for preventing case import and resurgence at home. The Chinese government will continue to do a good job in controlling the disease at home, and we will continue to provide assistance to other countries to the best of our ability. Now, thank you. Thank you. Now the floor is open. Please identify yourselves before raising the question. Thank you. With CGTN, the extraordinary G20 Leaders Summit will be held tonight. What are China's expectations for the summit, and what proposals will be made? This is a very good question. Indeed, the whole world will pay its attention to the extraordinary summit. Now we are facing a special time of the outbreak of COVID-19 in multiple places across the world. It is threatening the life and health of people around the world and undermining the global economy. So this meeting is very important and timely. The international community all hope that the G20 can mobilize resources across the world to fight the pandemic and stabilize the global economy. G20 is an important platform for global crisis response and international cooperation. It played an important role in responding to the 2008 international financial crisis. At such a crucial moment, the international community looks to G20 for playing a leading role once again. As a matter of fact, all G20 members are victims of the disease. This extraordinary summit will be the first video summit in the history of this mechanism. The summit will be an important opportunity for various members to explore joint actions. This summit will also be President Xi Jinping's first attendance at a major multilateral event since the outbreak of COVID-19. At home, China has made important progress while also actively supporting others in their fight, and our efforts have been applauded by the international community. China hopes and believes that this summit will send a positive message for working together to defeat COVID-19, stabilizing the economy, and reaching important consensus. China is ready to work with other G20 members to ensure the positive and practical results of the summit. Thank you.
你好，谢谢主持人，我是中央广播
Thank you, Mr.
中国
Moderator.
国际电视台 CGTN 的记者。
With
那么
CGTN,
在这次国务院新闻办的新闻发布会召开之前呢，
Before
我们
this press
CGTN 特别
conference,
在网上对这次新闻发布会进行了
CGTN
预热，并且向广大
had
的
an
海
early
外网友
warming
征集
for
了他们
this
所关
conference,
心和
and
关
we
注
have
的问
also
题。那么
elicited
在我们所
questions
征集的这些
from
问题当中
international
呢，有
users
很
and
多问题
viewers,
都集中在中国经验分享
and
方面。 那么在
their
这里呢，我
questions
就带
mostly
广大
about
的海
how
外网
China
友
would
提
share
的
its
问题。
experience
中
with
国在
others.
应对疫情的方面呢，
And
积累
my
了很多
question
宝贵的经验。
is that
那么
as
在
China has
面
gained a
对
lot of
严
experience
峻
in
的
fighting
全球疫情
COVID-19,
形势，中国有什么样具体的经验
what kind
和
of
国际社会来
specific
分享呢？
experience can China share with others? Thank you.
好，谢谢，谢谢你代表广大的网友啊提出这个问题。
Thank you for raising this question on behalf of the international users. And here, on behalf of the Foreign Ministry, I'd like to answer this question. Facing this outbreak, China has been fully dedicated to fighting it. We have built the first defense line. We have bought time for the whole world and gained valuable experience in this fight. As COVID-19 is spreading across the world, China continues to work hard to ensure the success of epidemic control at home, and we have also shared experience with over 100 countries and organizations. We have held video conferences with WHO, ASEAN, African Union, EU, CARICOM, SCO, South Pacific countries, Europe, South Asia, Africa, and Latin America. We've held nearly 20 expert video conferences with over 110 countries. The meetings focused on control measures, diagnostic treatment, and the tracing of close contacts. The Chinese experts gave advice to their foreign counterparts, and the international experts all applauded such video conferences. They believe that the meetings are very informative and professional, and the Chinese experts have provided them with very good advice. Number two, we have also sent medical teams to countries severely affected by COVID-19. On February the 27th, we sent medical team to Iran. So far, we have sent 7 medical teams to Iran, Iraq, Italy, Serbia, and Cambodia. These doctors and medical workers will have braved the difficulties to brave the difficulties and go to other countries to help them, are being warmly welcomed by local governments and people. As I mentioned, that Serbian President Vučić welcomed The Chinese medical workers at the airport also kissed China's national flag. And when Chinese medical team arrived in Cambodia, Cambodian international users all gave a thumb up to Chinese medical workers. When the team arrived in Italy, a lot of people were queuing to welcome the experts, and the people in Milan also played China's national anthem to express their welcome. We were deeply moved by this. Number 3, we have actively shared our diagnostic plans with other countries. Since the outbreak of the COVID-19, we have acted in an open, transparent, and responsible manner. We have also reviewed good experience, and now we have the plans for prevention and control, diagnostic plan, and treatment plan, and the plan for the management of close contacts. We have translated these plans into multiple languages and shared them with other countries. These documents have been uploaded to the websites of the Foreign Ministry and our diplomatic missions abroad. Going forward, we will continue to stay committed to the community with a shared future for mankind and provide more public goods for the international community who contribute to China's experience and plans for the world and work together with others to defeat COVID-19.
I think you asked a very important question. I believe you may have already noticed that China has made great progress in epidemic control and the disease treatment. There are a lot of experience that we gained from our outbreak response, and we are ready to share with the rest of the world. First, in terms of our response philosophies, we believe that the response should be for the people and by the people. So we put the health and the life of our people first. I think that has been a very important factor in our success. That is the philosophy of people orientation. And also we have a very good system of leadership. General Secretary Xi Jinping personally directed and led the process, so it has been a very effective system of command. And also we have made sure that our response are law-based and science-based and targeted. This is also an important factor that ensured our success. As for the specific practices, we have made sure that our response happened at the early stage and at the...
Say, okay, I know him, he's a good guy.
And also, we ensured coordinated response nationwide. That means we coordinated the distribution of medical supplies and worked closely with all stakeholders to enhance our treatment capacity. And we attach great importance to the role of science and technology. So our response have been science-based in the whole process. And also, we have acted in an open and transparent manner in enhancing cooperation with the world. So we believe these philosophies and practices have proven effective by our response progress, and we are ready to share with the world these experience and practices to uphold global public health security. Now, next question.
您好，我是澳门日报记者，请
from Macau daily. So, how the Chinese government decide on which country can receive China's assistance, and what kind of assistance will be provided? Will China consider the reciprocal support that you have received from these countries in the early stage of your response?
Thank you for your question. We will identify and formulate our assistance plan. We have mainly considered the following reasons. Number one, the severity of the situation, the conditions of public health, as well as their medical supply conditions. Number two, the specific assistance requests from relevant countries to China. Number three, the ability we have. Well, for us, as we ensure the success of epidemic control at home, we have also provided assistance. As our ability permits, we have formulated relevant assistance plans, including the quantity and types of supplies, and these things have been arranged and decided by the governments of the two sides. For the Chinese people, we reciprocate kindness with kindness. For those countries that have supported China in fighting COVID-19, we will never forget them, and we will reciprocate their kindness. Meanwhile, we are aware that different countries have different national conditions and abilities. We thank our friends for their material assistance, and we equally value their political and moral support. As we conduct international assistance, we not only reciprocate kindness, we also believe that a friend in need is a friend indeed. This year marks the 70th anniversary of China's international assistance. In the past 7 decades, in spirits of internationalism and humanitarianism, we have provided assistance to developing countries to the best of our ability. In particular, in terms of emergency humanitarian assistance, we have provided emergency support for those countries hit by major natural disasters and communicable diseases, and our efforts have been applauded by the international community. For the Indian Ocean tsunami, Nepali earthquake, and in the epidemic of Ebola, plague, and Zika disease, China's assistance has never been absent. Now the global pandemic is still evolving, and countries around the world are responding to it. Even as the spread of the virus nationwide has been effectively stemmed at home, the risks for sporadic infections and localized outbreaks have not gone away. While ensuring epidemic control at home, we will continue to provide assistance to other countries to the best of our ability. We also hope that more parties will get involved in international assistance. The fire burns high when everyone adds wood to it. As long as the international community can stay united, we will defeat COVID-19 and uphold the well-being of people around the world. Next question, please.
Associated Press of Pakistan.
The things there too, right? The solar part, there's the element of biomass.
China has provided help to its iron brother to effectively fight against the pandemic. Can you provide us some details about the assistance from China to Pakistan? Thank you.
请翻译一下。我是来自巴基斯坦联合通讯社的记者。那么，自从巴基斯坦爆发疫情以来，中国一直向自己的铁哥们儿巴基斯坦提供了援助。那么，在中国对巴援助的细节方面，您能不能给我们多介绍一些信息？谢谢。邓处长，要不你先。谢谢。
好，谢谢巴基斯坦的记者朋友。
Thank you for your question.
一直以来，中国和巴基斯坦都是患难与共的。
China and Pakistan are all along true friends and brothers that have shared weal and woe. Our special friendship is a choice of history, and it is deeply rooted in the people of the two countries. As China was fighting the epidemic at home, Pakistan extended us great support. Pakistan mobilized all possible medical supplies to support us. When President of Pakistan visited China, he said that to use medical supplies across the country to support China, this is something that a friend should do. We have left no leeway for ourselves. Such measure has moved numerous Chinese people. The story has been spread across China. It shows that our two countries are really iron brothers. At the moment, our two countries are both facing the challenge. China is ready to share experience with Pakistan and provide Pakistan with badly needed medical supplies so that we can jointly respond to the challenge. As I mentioned, so far we have provided 4 batches of international assistance. As a matter of fact, we have already provided 4 batches of assistance to Pakistan in terms of testing reagents, protective suits, facial masks, ventilators, and other medical supplies. For the next stage, we also plan to provide more urgently needed assistance to Pakistan. In addition, we will also support Pakistan in building a temporary quarantine hospital. We believe that human beings would strengthen their friendship in fighting the pandemic. Through cooperation, China, Pakistan, and other countries will score the final victory against COVID-19. Thank you.
And let me make some additional points. In terms of medical technologies, China shared with Pakistan immediately our therapeutics and prevention protocols for the COVID-19. We also shared with our Pakistani friends through video links China's experience in treatment and containment. We also had very good discussions on other issues of Pakistan's interest. And as required by Pakistani side, China is preparing a medical team to Pakistan, and this expert team will pay field trips to different localities in Pakistan and have experience sharing and technology exchanges with our Pakistani friends. And also, the Chinese team are discussing with the Pakistani side on other assistance and technology support in light of local conditions. Next question.
谢谢发言人。经济日报记者提问：
Thank you. I'm
在
from
疫情发生后，中国第一时间向世卫组织分享了新冠病毒的基
The
因序列。
Chinese side
我
shared
想请问
with
一
the
下，中国在保
WHO
障
the
科学
genome
数据和
sequence
信息
of
共
the
享方面
virus
做了哪些工
immediately.
作？
So what
怎么看待
China
中国
did
科学
China
家在
do
此次抗击新
in
冠疫情中发挥的作
sharing
用？谢谢。
technologies and what do you see the role of science
非常
in
感谢
outbreak
这位
response?
记者的提问，
Thank you for this
这是一
question.
个非常重要的问题。
This is indeed
因为
a very important
科学数
question
据和信息的共享是
because
国际合作的前
the
提
sharing
和
of
基础。
scientific data
关
and
于这个问题，
information provides
我
an
想媒
important
体朋友可
basis
能
for
注意到了，
international cooperation on
习近平主
COVID-19
席
response.
对科技工作
And
前一段时
General
间进行了
Secretary Xi
考察。
Jinping
关于国际合作，习近平主席有一个
attached great
要求，
importance to
这个要求
international
原文是这样说的：
cooperation, and
要
he
共享
made
科研数
it
据和信
specific
息，
that
均
we
等
need to
研究，
share with
提出
the world
应对策
our
略。
data and information
我们理
and
解
work
这个要
with
求，
the
就是说
world to
新冠
identify
疫情是
response
全球我们共同
approaches.
面对的问题。我们要解
That
决这个
means
问题，
the
必须依靠
COVID-19 is
全
a
球科
common
技界的共
challenge
同
for
努
all
力，
of us,
集中
and
全
we
社
need
会
to
的
work
智慧，
together to
同
pour
时
our
我们取得
wisdom
的成果
to address
也必
this
须
challenge. And
全人类共享。
whatever
所以简单
deliverables
的说，
that
就应该是
we
共同面对、
developed,
共
we
同
need to
研究、
share with the
共享成
world.
果。
So that is, put it simply, that is joint research and sharing of deliverables. So China has shared with the world the genome sequence, which we believe is something we should do. It is natural. So first of all, we shared with the world the genome sequence as early as January the 11th. It is because of the sharing of this information that scientists all over the world have the basis to study the virus and develop the vaccine. And China established 2 platforms to share the data. The first is a global coronavirus data sharing and analysis system under our micro genome study center, and we had another platform that is called the Novel Coronavirus 2019 Data Bank. This data bank has provided data services to visitors from more than 152 countries. There have been 76,000 visits and 4.44 million downloads. Over 60% of the visitors are foreign scientists. And also, we published a number of high-quality journals. The Chinese side are working to build a platform of sharing of journals and other outcomes. Once at an occasion when we reported to State Council leaders on what we have achieved in our scientific research. And at that time, we were asked if we have a way to have a timely sharing of this data with the world so that the whole world will benefit from what China has achieved. So we were required to have a platform that can put all the data and the journals on that platform, and also we were required to publish what we have achieved or discovered in top international journals in English. Therefore, we established a platform to share the achievements we've made and also the discoveries we found in COVID-19 response. We have uploaded 99 journals and many other theses and other studies. And also, Chinese scientists published 54 journals in the top 7 international journals. And the Chinese CDC published an analysis report based on 72.3
information is probably basic need. That's what I put it. Okay. So it's not the Wi-Fi per se. Wi-Fi is the enabler of the information.
Right.
Human beings are information animals.
And third, China are building an exchange mechanism. First of all, under the framework of the WHO, we participated in the 10 task forces and have kept in close contact with our foreign counterparts. For example, one of my colleagues told me that he attended more than 40 conferences in 20 days, and she had a very good discussion with foreign counterparts on the animal model. And also, we have engaged in very good exchanges and cooperation with non-governmental organizations through video links and some other ways. And also, the exchange between experts and scientists are very important, especially given the current context. The So their video conferences have been quite productive. And fourth, China engaged in technological cooperation with the world in a very proactive manner. First, let me talk about vaccines. We are adopting a five-pronged approach, and we are cooperating with many foreign companies in this regard. And we involved not only many scientists, but also many other researchers. And also we are providing a number of services to foreign experts in sharing technologies. As for the role of scientists in this response, I believe that in such a short period of time, the fact that China managed to put the epidemic under control and increased the cure rate and reduced the case fatality rate in such a short period of time is a result that can hardly be achieved without the contribution of scientists. A month ago, I attended a press conference, and during the past month, we've made a lot of progress. The 1 month may be a rather short period of time for scientific research, but 1 month, we cannot wait for another month because we need to save lives. That's why we've been working around the clock to make breakthroughs, and of course we believe that international cooperation has been very important in this regard. Let me make some additional points. We believe that the media also play an important role. For example, there has been a program online and on air that is a program on the joint treatment of different cases, and also we have another program that can share the Chinese experience in English. We hope that the media will continue to play an important role in information sharing and joint cooperation. Thank you. We noted that China sent expert teams to Serbia, Italy, and Cambodia. What are the main roles of these expert teams, and what have they done? Thank you for your question. The coronavirus outbreak is already a pandemic. The virus knows no borders, and countries are in a community with a shared future. And we feel for those countries who are now under the challenge of the pandemic. When China was at the critical stage of epidemic response, we received many valued support from a number of countries. So as China managed to put the situation under control domestically, we are ready to live up to the vision of the community with a shared future for mankind and take concrete actions to support those countries in epidemic response. And we would like to share our confidence with them to beat the virus. At the request of the government of Italy, Serbia, and Cambodia, we sent expert teams to help with their response. Our teams are formed with public health experts, clinical experts, and psychological
that we are going through as part of human societies.
Oh, yeah.
The moment the universe came into existence, scarcity was created along with it. Even in this age of global abundance, scarcity can be felt across different societies. Technology plugs the gap, but it also creates new problems.
然后更多青少年他们心态已经有点浮躁，就是他们静不下来心。
Basically, the world is like moving ahead 100 miles per hour, and some people are not able to catch up.
Every time there's new technology, some classes of jobs disappear.
Instead of eradicating scarcity, I'm inspired to understand how we can do more with nothing. What in your life is becoming more scarce these days? What is scarce? What would you like more of? Would you be able to make the change? Watch Chasing Scarcity on Demand at cna.asia.
Singapore's economy takes a hit from the global pandemic in the first quarter of this year. The Trade and Industry Ministry revises down its growth forecast for the whole year. A World Health Organization chief warns against any rush to lift lockdowns, calling them an invaluable second window of opportunity to contain COVID-19. Meanwhile, financial relief could be on the way for countries grappling with the pandemic, as the UN launches an appeal for $2 billion in aid. Australian man accused of carrying out terror attacks on 2 Christchurch mosques more than a year ago pleads guilty to all charges. And we're tracking the top news stories across Asia and the globe. Singapore's economy contracted significantly in the first quarter of this year as key sectors took a hit from COVID-19. Advanced GDP estimates for Q1 came in at minus 2.2% on year. It's worse than market expectations of a minus 1.4% decline. The Trade and Industry Ministry has downgraded its growth forecast for the entire year to minus 4 to minus 1%. Henry Yin tells us more.
Chinese.
Singapore's economy contracted by a pace of 2.2% in the first quarter of this year. So that's according to the advanced GDP number released in the last hour, which compiled the numbers from the first 2 months of this year. So the numbers actually, like you've mentioned, is worse than market expectations and also reversing the 1% growth recorded in the previous quarter. And on a quarter-on-quarter seasonally annualized adjusted basis, Singapore's GDP shrank by a pace of 10.6%. So earlier I've spoken with OCBC's Head of Treasury Research and Strategy, Selina Ling, who told me that the numbers suggest that the COVID-19 is just like an economic tsunami that's striking on Singapore's shores, which certainly warrant a big stimulus, a physical bazooka this afternoon, followed by the possible MAS policy easing. And breaking down the number, so the manufacturing sector contracted by a pace of 0.5% year-on-year in the first quarter, and moderating from the 2.3% contraction in previous quarter. And that quarter's growth was mainly weighed down by electronic as well as chemical clusters. In the meantime, the services industry, which accounts for 2/3 of the country's economy, contracted by a pace of 3.1% year-on-year in the first quarter, and also the construction sector shrank by a pace of 4.2% year-on-year in the first quarter. And of course, the second big headline for today is that Singapore downgraded again of its full-year economic growth to -4% to -1% for the full year of 2020, which is showing that the economy is heading for its first full-year recession in over 2 decades.
Earlier, we spoke to Barnabas Gunn, economist at United Overseas Bank. He explained how he thinks the economy will have further impacts should this pandemic be prolonged.
The situation is, I think, more different than what we really hoped for. Back in 2003, when we saw the SARS outbreak, Singapore only saw a 1 quarter year-on-year contraction back then in the second quarter of 2003. And by May 2003, the World Health Organization has declared Singapore to be SARS-free then. From where we are standing right now in March 2020, and given how the COVID-19 outbreak has been seen across the world, I think the chance for Singapore to be COVID-19 free by May 2020 seems to be far-fetched possibilities. Do note that Singapore is a trade-reliant economy and we manufacture to trade. And because of that, not only the tourism and the retail sectors, hospitality may be affected due to the reduced tourism numbers, but more so from the supply chain disruptions that we have seen across the world. Exports and manufacturing may be the next sectors that could actually may actually suffer into 2020 itself.
Meanwhile, Singapore has reported 2 new COVID-19 clusters. They are PCF Sparkle Tots Preschool at Fengshan Block 126 and Dover Court International School. The number of new cases has risen by 73, a new record high in a single day. This brings the total number of cases in Singapore to 631. Of these new cases, almost half are local, including 27 linked to clusters or previous cases. 8 are currently unlinked and contact tracing is underway. The other 38 are imported. All except 1 are returning residents and long-term pass holders with a history of travel to Europe, North America, ASEAN and other parts of Asia. 5 more cases have been discharged, and that brings the total number of recovered to 160. Of the 404 still in hospital, 17 are in critical condition. 65 cases who are clinically well but still tested positive for COVID-19 have been transferred to various private hospitals or the community facility for isolation and care. 2 patients died on Saturday. Singapore's Deputy Prime Minister Heng Swee Keat will unveil a stimulus package to help Singaporeans tied through the COVID-19 crisis. Calling this the resilience budget, Mr. Heng will give more details later this afternoon at 3:30 p.m. Our reporter Tan Si-Hui looks ahead and tells us more.
In the last 5 weeks since the first support package was announced in budget, the outbreak has been declared a pandemic. In Singapore, we've seen a massive increase in new cases from about 80 to more than 600. And earlier this week, tighter border measures led to anxieties across sectors, with Singapore Airlines in particular slashing 96% of its capacity. The tourism, retail, F&B sector have been the hardest hit. In a Facebook post, Deputy Prime Minister and Finance Minister Heng Swee Keat said he's calling the supplementary budget the resilience budget. He said it will help save jobs and support companies with more from those who are hardest hit. Households will also receive additional help to tide through this period. Analysts have pegged the package to be a hefty one, estimating that it could be about $16 billion. Deputy Prime Minister Heng had previously said that the government may consider drawing on Singapore's past reserves for this supplementary budget, but noted that he will need to get the approval from the President and the Council of Presidential Advisors to use the reserves. Now here's a little context. The first and last time the government tapped on past reserves was in 2009 to draw a total of $4 billion to cover budget expenditure when the global financial crisis happened. And also a little recap of the first support package announced in the budget. It was $5.6 billion. $4 billion went to helping enterprises, and the other $1.6 billion went to households to defray cost of living. But the situation has worsened over the last 5 weeks. We know that the first support package is already much higher than the $230 million relief package during this SARS crisis, and it underlines the urgency at which the government intends to keep the economy afloat.
Singapore Deputy Prime Minister and Finance Minister Heng Swee Keat will deliver the resilience budget in Parliament at 3:30 this afternoon. We will have full live coverage right here on CNA and on radio on CNA 938. The World Health Organization has warned countries against wasting a narrowing window of opportunity to curb the spread of COVID-19. It says countries that have introduced lockdown measures must now focus all efforts on finding new infections so as to suppress and control the pandemic. The UN Health Agency's chief, Tedros Adhanom Ghebreyesus, called COVID-19 public enemy number one. He urged countries to avoid squandering time and resources to combat the outbreak. He says the world has previously overcome many pandemics, but questioned how many more lives will be lost in the process this time. The answer, he says, will be determined by the decisions and actions of governments and people and what they make at this crucial juncture.
Asking people to stay at home and shutting down population movement is buying time and reducing the pressure on health systems. But on their own, these measures will not extinguish epidemics. The point of these actions is to enable the more precise and targeted measures that are needed to stop transmission and save lives.
Well, that comment from Dr. Tedros comes as the UN launched a $2 billion appeal to help vulnerable and conflict-torn countries fight the pandemic. Secretary General Antonio Guterres says the money is important to shore up health systems of poorer countries so they do not collapse under the scale of the outbreak. He's urging governments and wealthy individuals to give to this important cause. Will Denzel joins us more on the UN's humanitarian effort to combat the coronavirus pandemic.
And this is an appeal that's set to protect what the UN describe as the most vulnerable people around the world. They target a number of regions: South America, Africa, the Middle East, as well as Asia. Now, essentially, this funding will be to help both NGOs as well as the UN's member agencies. Now, there are several real areas that the United Nations is looking to target specifically. This money will go towards laboratories that can not only conduct testing, but can also provide help for those in need. It provides hand washing stations in perhaps hard to reach camps and for people that might not have access to the ability to wash their hands with clean water. Also public information campaigns, as well as funding to allow NGOs as well as supplies to reach some of these hard hit areas and more remote areas around the world. Now, we've heard from the United Nations Secretary General Antonio Guterres. He says that currently we're living in a war situation and what we need is a war economy. He said that the global response to COVID-19 can only be effective if it's global. Let's have a listen.
The worst thing that could happen is to suppress the disease in the developed countries, but let it spread like fire in the developing world, where then millions of transmissions would take place, millions of people would die, and the risk of mutation would be there, which means that the virus could come back in ways that even vaccines that I hope will be soon developed won't be able to stop it again.
The hope is for the United Nations is that this funding will help protect these vulnerable populations, to help make this global effort more rigorous, to help those that are in most in need. And they also hope that this funding will also do a great deal to protect those on the front lines that are out there risking their own lives to protect those most in need.
Amidst nationwide lockdowns, many countries are grappling with fast-falling supplies of critical medical equipment. We'll speak to the president of the Malaysian Rubber Glove Manufacturers Association on how they are doing all they can to ramp up production. That in just a moment. Stay with us.
(1918) Spanish flu, 2003 SARS outbreak, 2009 H1N1 flu, 2012 MERS epidemic, and now COVID-19. Infectious diseases which have killed millions around the world.
It causes a lot of damage, causes a lot of injury to the lungs, and in turn kills a lot of people.
The world had probably never encountered this particular flu before. No immunity.
Will humanity ever win the battle against these deadly viruses?
A virus-free world is impossible, but we must have solutions in place.
COVID-19, the invisible enemy. Insight tonight on CNA.
Asia Tonight. The day's top stories and their impact on the region.
Donald Trump and Kim Jong-un are on their way.
He's been charged with money laundering.
We put ourselves into a position of strength.
With in-depth analysis and reporting from Asia's most extensive network of correspondents.
India launching airstrikes against...
Residents want the base off Okinawa.
Delivering the stories that matter most. Asia Tonight. Weeknights on CNA.
Cyber attacks can hurt us in the real world.
How sure are you to know that the water you're drinking is safe?
The fear always is, what if?
And our laws can't protect us.
If hackers want to attack you, they will succeed.
Who can defend us from a world of cyber threats?
Cyber domain is emerging as a new frontier for battle.
Secret Wars. Sunday on CNA. In life, you might make a bad choice. Chase the wrong dream. Or time your actions badly. But good advice can make a lifetime of difference. The right decisions at the right time with QNB.
Our addiction to carbon has dire consequences.
These increasing storm surges, it's just going to take away all this land and it's losing home.
Technology can offer us a way out.
Technically speaking, we could generate and meet 100% of our electricity needs through clean energy sources.
The time for change starts now. Carbon Conundrum, Tuesday on CNA.
Singapore's economy takes a hit from the global pandemic in the first quarter of this year. The Trade and Industry Ministry revises downwards its growth forecast for the entire year. The chief of the World Health Organization warns against any rush to lift lockdowns, calling them an invaluable second window of opportunity to contain COVID-19. Meanwhile, financial relief could be on the way for countries grappling with a pandemic, as the United Nations launches an appeal for $2 billion in aid. Worldwide, we've seen a panicked scramble for masks, hand sanitizers and rubber gloves, all critical for hospitals now swamped with cases of COVID-19. Making things worse are plunging supplies as manufacturers in many countries wind down productions as part of urgent containment measures. Top medical glove supplier Malaysia makes at least 2 of every 3 pairs of gloves worldwide. But a month-long movement control order, or the MCO, now in place means that may no longer be the case. Malaysian Rubber Glove Manufacturers Association, or MAGMA, is a non-profit organisation that represents more than 70% of Malaysia's glove makers and is lobbying hard to get production back to full capacity. The man behind MAGMA, that's the President Dennis Lau. He joins us now from Kuala Lumpur. Dennis, as I just mentioned, you are working very hard, lobbying almost every hour to get production back to above 50%, which is where it's at right now. How far short are we at 50% compared to 100%?
In the normal circumstances, you need about to produce 616 million pieces of gloves per day in order to meet the world requirement of about 225 million this year. Export from Malaysia alone should be about 225 billion pieces of gloves this year. And we expect the world to consume something like about 330 to 335 billion pieces of gloves, especially now that the COVID virus is rampaging across 196 countries in the world. Now, we are fighting very hard to make sure that there's enough gloves to go around, but then again, we are now operating at only 50%, and this is due to the Malaysian government imposing the MCO, which means Movement Control Order, and they only allow us to work at 50% of our normal workforce. This will mean that 300 million pieces of glove will be lost per day if we don't operate at 100%. And today we are talking to the government. We will be talking to the government very regularly, and hopefully by today we should be able to get the answers from the government that we should be allowed to operate at 100% on a normal pace. The world is very short of gloves now.
Sorry for cutting in like this. You framed your lobbying effort in terms of, you've called it, Malaysia is duty-bound. We need to be responsible for the welfare of all humanity in the world, hence the production of gloves. But presumably, Malaysia's government has imposed the movement control order for a month because it wants to protect Malaysia. Quite practically, by cutting production, they're reducing the risk of transmission. So how do you get what you want while reassuring your own people, your people who work for you, that they are still safe? Are they still safe?
That is understandable where the government is coming from. They are actually restricting movement of people so that people don't contact each other, and this is, to a certain extent, can contain and suppress the spread of the virus. But then, having said that, we are also under instructions, strict instructions from the Malaysian International Trade and Industry Ministry that we must engage in general good practice, good management practice, and we are also to give to our workers face masks, sanitizers, shoe covers, and the whole place must be disinfected so that we can operate under a very conducive environment, free of all these viruses. And we hope that with these measures, we are able to protect our people at the same time protecting the world.
Dennis, that said, even in October last year, in an interview, you mentioned we are crying for workers right now. You did not have enough labourers at that point for several reasons. The new government that has now changed again had imposed caps on foreign workers. There were some issues with the US border and customs control authorities. So you did not have enough workers at that point. Has that problem been resolved? And how are you going to be ramping up production if you still have issues with worker numbers?
We are the world's largest producer, and by that status, we know what to do and we know how to transform ourselves from being a labor-intensive industry to an automated industry. Today, stripping the gloves, formerly if we need, let's say, 12 people to strip 1 million pieces of gloves, today we only need 1.3 people to 1.5 people to produce 1 million pieces of glove. That's how far the Malaysian glove industry has become. And every other month, we are finding more and more automation being put in place into the factories so that we do not have to be dependent on foreign workers that much. Therefore, as we move along, we are finding our own ways, we are finding our own design in engineering and design so that we can all produce the gloves using as little people as possible.
All right, Dennis, in which case, if you're not using people, you are, as you mentioned, looking at automation. Now, if anything, this global pandemic is reminding many countries of how when you build up infrastructure for expected demand, expected supply, and suddenly that's gone, what do you do? So Malaysia, say this year, you ramp up production because you have this surge in demand. When the demand is over, when the pandemic is over, and it will be, what happens to all this built-up infrastructure? Have you planned for that?
Every glove manufacturer will have factories that are utilizing the product lines at the most, maybe 85% on an average. But today, if there is a need and a requirement in the world, we can always ramp up capacity right up to 95%. Now, from 85% to 95%, there's 10% more. That's a lot of gloves to be produced.
All right, thanks very much indeed. That was Dennis Lau. He is the president of Malaysian Rubber Gloves Manufacturers Association, which is now under very big pressure to ramp up production to meet soaring demand for rubber gloves for medical use. Thanks so much indeed, Mr. Lau. It's time to check on market movements across Asia. Here in Singapore, equities sank in early trade after authorities flagged a deep recession. The benchmark STI erasing some of the gains from Wednesday's session. Singapore Airlines on a trading hold pending an announcement. And a somber trading day as well in mainland China. Indices in Shanghai and Shenzhen both losing ground since their opening, but now they've gained. Shanghai up 0.24 and Shenzhen up 0.21. Hong Kong stocks kicked off on a slightly more positive note, but it's down now 0.43%. Elsewhere in Asia, Japan stocks flashing red on profit-taking after surging in recent sessions. Both the Nikkei and the broader Topix index dipping into negative territory. South Korea's Kospi buoyed by the central bank's announcement that it will pump cash into money markets. And that's essentially relaxing FX liquidity rules for banks for 3 months. And down under shares in Australia saw early gains. The third positive start this week. The ASX 200 now up just over 1%. New Zealand is the top gainer in the Asia Pacific this morning. The NZX 50 still soaring high at this point, up more than 4.5%. It's a mixed picture in other Southeast Asian markets. Stocks trading mixed as investors watch developments in the US, with lawmakers working on a massive stimulus package to rein in the impact of COVID-19. India e-commerce firm Flipkart will resume sales for essential products after receiving assurances from the government for the safe passage of both delivery workers and supplies. Well, this comes amidst reports that some of India's largest online retailers are facing delivery disruptions and warehouse shutdowns. Amazon.com's pantry grocery service was also unavailable in several cities, with delivery dates stretching into April. India has ordered a 21-day nationwide lockdown to stop the spread of COVID-19, and that has led many to turn to online retailers for household goods. SoftBank Group has blasted Moody's for downgrading its rating by 2 notches to Ba3. The firm is asking for those ratings to be withdrawn, accusing the ratings company of being biased and creating substantial misunderstanding. This comes days after SoftBank announced a $41 billion asset sale program to fund its biggest ever stock buyback and to shore up investor confidence. Moody's says it's reviewing SoftBank for a further downgrade as the firm moves to sell down core parts of its portfolio. SoftBank's shares falling more than 9% on the news of that downgrade, and that's put an end to its impressive 55% rally. Video streaming giants are reducing video quality in more countries worldwide to ease congestion on telco networks. Netflix says it will reduce data traffic in India, Australia, and some Latin American countries. Facebook will also temporarily cut picture quality for videos on its sites in India. Similar moves in Europe, where companies from Amazon to YouTube have cut picture quality to prevent overload. Video streaming has boomed in recent weeks after billions worldwide have been ordered to stay at home. Apple may delay the launch of its first 5G iPhones by months. The Nikkei Asian Review reports the pandemic has disrupted the company's product development schedule. Coupled with weak global demand, supply chain challenges could push back the release originally scheduled for September. Moreover, many employees at Apple's headquarters are working from home indefinitely under government lockdown orders. Apple is already a year behind its two biggest rivals, Samsung and Huawei, in introducing a 5G-capable handset. And still on Asia now, necessity is the mother of invention. Household appliance giant Dyson puts its huge team of engineers to designing ventilators for medical use. Details of that story in just a moment. Stay with us.
お、今日も綺麗ですね。
ありがとう。昨日言ってくれなかったけどありがとう。
昨日ちょっと疲れてたんですけど。
ほら、すぐ箸通る。
着いた。
うわー、雰囲気ある。
神様から呼ばれてる。
せーの。
Japan Hour, Saturday on CNA. Japan Hour is brought to you by Sumitomo Corporation, ANA, and SMBC.
November 2019, Delhi becomes the air pollution capital of the world.
You're literally waking up, getting out of your house, going through a gas chamber.
India's Supreme Court steps in. Find a solution or face the consequences.
We don't need any more policy, we just need implementation.
Can Delhi prevent another air apocalypse? Undercover Asia investigates. Saturday on CNA.
This Saturday, private property sales in Singapore strong despite the COVID-19 virus. But will the sector remain resilient?
The upside potential is a lot more than the downside risk.
Also, assessing the knock-on effect on the office property market.
The next 5 years, supply is very short.
And does living longer mean a different view of retirement?
Multi-stage life, where you may have many different careers.
Saturday on CNA.
Singapore's economy takes a hit from the global pandemic in the first quarter of this year. The Trade and Industry Ministry revises downwards its growth forecast for the entire year. The chief of the World Health Organization warns against any rush to lift lockdowns, calling them an invaluable second window of opportunity to contain COVID-19. Meanwhile, financial relief could be on the way for countries grappling with the pandemic as the United Nations launches an appeal for $2 billion in aid. The Australian man accused of carrying out terror attacks on 2 Christchurch mosques more than a year ago pleads guilty to all charges. Nearly half of the world's population is now under some form of restriction on movements due to the global pandemic. More than 3 billion people have been asked to stay home in nearly 70 countries and territories. And the number of confirmed cases worldwide is nearing the 500,000 mark. American troops abroad have also been ordered to stop movement. U.S. Defense Secretary Mark Esper issued that order to last 60 days. It will affect all U.S. forces worldwide and their families. The aim is to ensure the virus is not brought back home and not spreading around the military. The exception is for Afghanistan, where a troop withdrawdown is underway. Currently, 67 U.S. service staff are infected with the coronavirus. It's unclear if they are stationed overseas. Back on the U.S. mainland, New York is the epicenter, the hotspot, heating up further. Cases crossing the 30,000 mark with more than 280 deaths. That's roughly half of the whole country's overall toll. More than 5,000 new cases were reported in just one day. Although the rate of hospitalizations appears to be slowing down. The governor credited measures to keep people apart. But he's warning the curve is still headed upwards and the peak is still 3 weeks away. New York, he believes, has become the hotspot because it's a migrant city.
Because we welcome people from across the globe. We have people coming here, we have people who came here from China, who came here from Italy, who came here from countries all around the globe. We have international travelers who were in China and who were in Italy and who were in Korea and who came here. And I have no doubt that the virus was here much earlier than we even know.
Taking a snapshot of the rest of Europe, where cases are nearing the 240,000 mark, with almost 14,000 deaths. Spain has become the second country to surpass China's death toll. It recorded 738 new deaths in the last 24 hours. The country now has 3,434 fatalities from COVID-19, with nearly 48,000 cases. The infection rate in Italy has slowed for the fourth straight day. The worst may not yet be over. Latest figures show that more than 7,500 people have died there in barely a month. There are now 74,386 declared infections. There's increasing worry about regions like Campania around Naples, where jumps of around 50% have been seen in the past 2 days. Prime Minister Giuseppe Conte has promised at least 25 billion euros in a second stimulus package to help the economy. He's also hinting at restrictive measures may not be extended until 31st of July.
Quello è lo spazio dell'emergenza, ma noi siamo pronti in qualsiasi momento e ci auguriamo prestissimo per allentare, la morsa di queste misure restrittive, per se del caso anche superarle e anzi siamo confidenti e fiduciosi che ben prima di quella scadenza che avevamo ipoteticamente fissato all'inizio si possa davvero tornare alle nostre abitudini di vita, anzi direi più.
In the UK, the death toll has risen to 465 as 28 more people succumbed to the illness. The total number of confirmed cases stands at nearly 10,000. The British Parliament was shut down for a month until the 21st of April to curb the spread of the virus. But amidst the gloom, over 500,000 people have signed up for a volunteer scheme to support the country's National Health Service. And millions of self-employed who are affected by this outbreak can expect to be paid up to 80% of their recent earnings. Well, the Prince of Wales has tested positive for coronavirus. Prince Charles, aged 71, is displaying mild symptoms, but, quote, otherwise remains in good health. His wife, the Duchess of Cornwall, has also been tested but does not have the virus. Benji Hire with this report from outside Buckingham Palace in London.
Prince Charles had been displaying mild symptoms over the weekend, and on Wednesday morning here, a statement read that in accordance with government and medical advice, both he and the Duchess are now self-isolating in their residence in Scotland. The tests for the virus were carried out by the National Health Service up in Aberdeenshire. And in this statement, the palace claims that it's not possible to ascertain from whom the prince caught the virus, owing to the large number of public engagements that he would have taken part in over the last couple of weeks. The Queen last came into contact with her son, the heir to the throne and future king, on March 12th. He was at that time reportedly in good health. The palace also adds that Prince Philip, the Duke of Edinburgh, aged 98, was not present at that meeting. To the royals' relief, Charles is still working. He's in high spirits and he is still up and about. And it's important to also say that the Queen is in good health. Benji Haya, CNA, Buckingham Palace, London.
Household appliance giant Dyson has received an order for 10,000 medical ventilators from the British government. The order comes as the country scrambles to source equipment to treat coronavirus patients. Dyson says the firm had been refocusing resources to develop a brand new ventilator product since receiving a call from Prime Minister Boris Johnson 10 days ago. In anticipation of cases peaking in the weeks ahead, Britain had been in talks with over 3,000 businesses about supplying ventilators. Its current stock stands at about 5,000 to 8,000. To Australia, no passengers will be allowed off cruise ships in Sydney until new protocols are signed. The protocols, which are still being negotiated, will be agreed between federal and state governments. Australia was cast into the spotlight after 2,700 passengers were allowed to disembark from the Ruby Princess cruise ship in Sydney last week. 133 people have since been diagnosed with the coronavirus. The incident sparked outrage amongst the community, with many questioning the country's protocols for assessing disease risk. The Australian man accused of carrying out terror attacks on 2 Christchurch mosques a year ago has changed his plea to guilty. Brenton Tarrant is accused of murdering 51 people when he opened fire on dozens before fleeing in a vehicle. The 29-year-old also pleaded guilty to 40 charges of attempted murder and a terrorism charge. For that, he'll be sentenced at a later date without trial and faces the prospect of spending the rest of his life behind bars. Prime Minister Jacinda Ardern, she is relieved by the plea, adding the admission of guilt would help provide accountability over this incident. Tarrant's actions have prompted her to tighten New Zealand's gun laws and launch a campaign to curb online extremism. And still ahead on Asia Now, demand has far outstripped supply for this new must-have, pushing many to do it yourself. How can homemade beat store-bought? We'll tell you how in just a moment.
(1918) Spanish flu, 2003 SARS outbreak, 2009 H1N1 flu, 2012 MERS epidemic, and now COVID-19. Infectious diseases which have killed millions around the world.
It causes a lot of damage, causes a lot of injury to the lungs, and in turn kills a lot of people.
The world had probably never encountered this particular flu before. No immunity.
Will humanity ever win the battle against these deadly viruses?
A virus-free world is impossible, but we must have solutions in place.
COVID-19, the invisible enemy. Insight, tonight on CNA.
Recognized as a high-tech megatropolis, Gangnam is equipped with advanced technology, making this city an ideal location for the modern tourist. Find the nearest amenities with a mobile application or update yourself with the latest info from public installations. Find out how to travel smart all day long in Gangnam. Sunday on CNA. Gangnam Insiders Picks is brought to you by the Gangnam-gu office.
Cyber attacks can hurt us in the real world.
How sure are you to know that the water you're drinking is safe?
The fear always is, what if?
And our laws can't protect us.
If hackers want to attack you, they will succeed.
Who can defend us from a world of cyber threats?
Cyber domain is emerging as a new frontier for battle.
Secret Wars. Sunday on CNA.
Our addiction to carbon has dire consequences.
these increasing storm surges, it's just going to take away all this land and it's losing home.
Technology can offer us a way out.
Technically speaking, we could generate and meet 100% of our electricity needs through clean energy sources.
The time for change starts now. Carbon Conundrum, Tuesday on CNA.
Probe deeper and discover this April. Money Mind. Eager to fund a 100-year life? From multi-stage financial planning to affordable healthcare, the new season explores ways to live and age well. For food's sake, travel across continents to find out how the most humble ingredients are seeing some of the biggest price hikes. A Frame in Time. Discover Singapore's most intriguing oil paintings that illustrate stories from poignant milestones of a time gone by. This April on CNA.
Singapore's economy takes a hit from the global pandemic in the first quarter of this year. The Trade and Industry Ministry revises downwards its growth forecast for 2020. While the chief of the World Health Organization warns against any rush to lift lockdowns, calling them an invaluable second window of opportunity to contain COVID-19. Meanwhile, financial assistance could be on the way for countries grappling with a pandemic, as the United Nations launches an appeal for $2 billion in aid. The US dollar giving up strength as investors worldwide brace for a surge in US jobless claims. Here in the Asia-Pacific, we see that weakness against a basket of currencies. The dollar currently dipping against the Japanese yen and the Korean won as well. The dollar sell-off is taking place as the US relief bill helped to boost risk appetite in the stock market and reduce demand for the safe haven currency. The Australian and New Zealand dollars, both of which are closely linked to the global commodity trade, falling against their US counterpart. As the recent shortage of US dollars sweeps the globe, pressures are seen across Asia's emerging markets. Those with significant budget and current account deficits like Indonesia and India are particularly vulnerable. But as of today, the greenback is easing against the Indonesian rupiah and the Indian rupee. Here in Singapore, the Sing dollar now trading, let's take a look at 14486 against the dollar. Earlier we spoke to IG Asia market strategist Pan Jingyi about the recent weakness seen in the Singapore currency and its outlook going forward.
Yeah, well, so I don't think on the very minimum that we are perhaps looking at, it's actually, a flattening of the slope. I think we've certainly seen, the Sing dollar itself weaken quite substantially, and that itself, including the Sing Near itself, is seen, the Sing dollar trading in the lower half of the band itself. So I think on the end, the weakness itself, I think, it's going to translate a little bit more towards a less or at least no appreciating perhaps for our Sing currency against the basket of currencies itself, and I think that will certainly see to a little bit of a help as well. Some are expecting perhaps a little bit more extreme measures, but on this end itself, I think definitely at the minimum, we're going to see a little bit of an easing of the policy over here. So on that end itself, I think it's really about we're seeing a bit of a working hand in hand between monetary and fiscal policy here in Singapore.
Well, the coronavirus economic stimulus bill has gathered enough support to pass in the US Senate. The voting, however, continues. Earlier, some senators had threatened to delay the legislation until changes were made on a key unemployment insurance proposal. Adam Bakhti gives us all the details of this proposed $2 trillion stimulus, which is meant to ease the impact of COVID-19 on the US economy.
Now, the package put together is massive, worth roughly $2 trillion. Senate Democratic leader Chuck Schumer called it the largest rescue package in American history, while Republican Senate Majority Leader Mitch McConnell described it as a wartime level of investment in the economy. Well, the full text of the bill hasn't been released, but the key outlines show just how extensive the aid is. Let's take a look at some key parts of this provision. Well, top of the list is income support, in effect, providing direct payments to American families from the U.S. Treasury. Meantime, business bailouts worth about $500 billion would be in the form of aid or for key industries hit hardest by the coronavirus spread. And of course, the beneficiaries will likely be the airlines and the cruise companies. Also included in the bill is unemployment insurance, and this would increase benefit payments to the unemployed by about $600 a week for up to 6 months. Now, this is the sticking point. Some Republican senators argue that this is counterintuitive and will encourage layoffs and further boost unemployment. Well, Democratic Senator Bernie Sanders is threatening to further hold up the voting if his colleagues don't drop their opposition. Well, the package also includes extra funding for hospitals as well. And finally, more help for small businesses to support companies with less than 500 members of staff to stay afloat. Well, the bill was agreed shortly after midnight on Wednesday, but it still needs to be voted on by lawmakers and signed off, of course, by President himself, Donald Trump.
I encourage the House to pass this vital legislation and send the bill to my desk for signature without delay. I will sign it immediately. We will have a signing, and it'll be a great signing and a great day for the American worker and for American families.
And an update on that in the last few minutes. The U.S. Senate has in fact passed this largest ever rescue package, a $2 trillion lifeline for suffering Americans, depleted hospitals and a ravaged economy. Our projections of an economic downturn that could surpass the impact of the 2008 global financial crisis are ringing louder. The World Trade Organization says its economists are still crunching the numbers, but figures are pointing to a worse recession than what we saw in 2008, as trade is headed to a sharp decline, which will consequently lead to job losses. But there is hope. WTO Chief Roberto Azevedo says fiscal and monetary stimulus measures enacted by governments around the world are all steps in the right direction. He encouraged coordinated efforts to increase the recession-fighting power of world economies and increase transparency on trade-related policies introduced to fight the coronavirus.
No country is self-sufficient, no matter how powerful or advanced it may be. Trade is what allows for the efficient production and supply of basic goods and services, medical supplies and equipment, food and energy that we all need. Keeping trade open and investments flowing will be critical to keep shelves plentiful and prices affordable. And once the medical crisis begins to recede, trade will allow countries to help each other, bringing faster and stronger economic recovery for us all.
Our G7 nations have also vowed to coordinate a global fight back against a looming economic meltdown. G7 finance ministers and central bank chiefs have said they will do whatever is necessary to restore economic growth, promote global trade and investments. A demand for hand sanitizers has soared since the start of COVID-19. Stores are selling out or have already sold out, so much so there are workshops now on how to make hand sanitizers. Early this morning, our correspondent Afifa Arifin showed Adam Bakhtir and Julie Yu what one can learn at one such workshop.
In these days, hand sanitizers, they've been flying off the shelves as everyone wants to keep their hands clean and germs-free. You know, I personally carry around a bottle or two of hand sanitizers in my bag. What about you guys? Do you guys carry them out when you go out and about?
I actually don't carry the hand sanitizers with me. I couldn't get any, so I've resorted to getting the Dettol wipes. I find, because you can wipe the surfaces and wipe your hands, it's a lot easier.
Yeah, and washing our hands more often than not. And,
yeah.
But I think we're very lucky to be finding, everywhere we turn, we can find it in our work, in our restaurants. But, I mean, Afifa, I guess it never hurts to be prepared for the worst case scenario. What can you tell us?
That's right. It's always good to be prepared. You know, DIY hand sanitizers, they're becoming a lot more popular these days. There are a lot of workshops, if you guys are keen, across town that can teach you how to make hand sanitizers. I went to one of those workshops and spoke to the participants and asked them why they decided to take part. Let's listen to what they shared with me.
I think in the wake of what's been going on around the world, DIY hand sanitizers might become a thing, and workshops like this is quite good because it's an activity for people to participate in with their family and friends, and at the same time maybe learn something useful.
So it's very interesting because as a parent I do not have any knowledge on how to make a hand sanitizer, so
it's a good event for kids bonding as well.
I think it's interesting, but because you get to customize the flavors and all.
I think this is a very good initiative to help everyone stay safe.
I heard that you need to get the ratio just right to make it 100% effective and maybe not too harsh on your skin.
That's right. So that's absolutely right. You know, the key to making an effective hand sanitizer is not just using the right ingredients, but also getting the ratio of the ingredients correct. And I'll show you guys how this morning. So joining me today is Jasmine Ma. She is a trainer for the Smell Lab, one of the companies who holds such workshops teaching people how to make hand sanitizers. So thanks for joining us this morning, Jasmine. So let's start. What's the first step to making a hand sanitizer?
Welcome to the Smell Lab hand sanitizer workshop. There are 5 components in this hand sanitizer. Right. First one is the gel base, alcohol, extracts, aerobac, and the Smell Lab essential oil.
All right.
There are also 5 steps here where we have beaker A and beaker B.
All right, so beaker A will contain the...
Beaker A will contain the gel base. And beaker B will be the alcohol.
Right, so
you have to pour in the alcohol slowly by slowly.
Okay, so the alcohol is about 11 grams of alcohol in beaker A and 11 grams of gel in beaker A and 19 grams of alcohol. So that's about the proportion. You've got to get it right from the get-go. It's about 1 part gel and 2 parts alcohol. The World Health Organization also advises that the concentration of alcohol be at least 60%. So this alcohol that we have today is about 65% concentration. And all we have to do is to pour it in and to mix it.
And stir vigorously.
Okay, so this whole process is going to take about 5 to 10 minutes. That's quite some time. We don't have the luxury of time this morning. So what we've done is that we've already made a batch earlier, and this is how it's supposed to look like, a clean and smooth solution. Okay, so what's the next step?
So next will be the C components, which is the extracts. It also contains aloe vera.
Right, so aloe vera, as we know, guys, is something that, you know, we use a lot to soothe sunburn, and it's really important to put it into your hand sanitizer as well because it helps to moisturize the skin, simply because the alcohol can be really drying on our hands. So
you drop in 6 drops.
Okay.
And you follow by the aerobac, also 6 drops.
Okay. And the aerobac also contains tea tree oil, which is also another moisturizing agent.
And the last, you put in the Smell Lab essential oil.
Right. Okay, so this essential oil that we're using is tea tree and lavender, and essentially it's just to create a scent.
Right.
All right. It smells really good, guys. Okay.
Congratulations, you have just completed your own hand sanitizer from the Smell Lab.
All right, so there we go. It's quite simple. Just to get the right ingredients in the right ratio, what you do afterwards is that you put it in a little bottle that you can take with you wherever you go. So just some tips when using the hand sanitizer. Remember to use it when your hands are dry, because it's not going to work if your hands are wet. And also, don't be conservative with the amount you put on your hands. You really need a good amount for you to cover the surface of your hands entirely, guys.
And, Fifa, I was just thinking, you mentioned one of the main ingredients was alcohol. I was thinking of dusting off my cabinet at home. There's so many bottles in there with alcohol content. I just did Googled out there, and you can get absinthe with almost 90% alcohol. I thought maybe that could be effective, or Mao Tai, for instance, the drink in China that's so popular at 53%, alcohol content. But I mean, back to, of course, trying this at home. I mean, some people say don't try these experiments at home because you might get it wrong, right? How effective really are they?
That's right. Well, you're correct. So, even if you do follow the right recipe, there's also a chance that you could get it wrong, especially when you're mixing it at home without any guidance. That's because, you don't quite know the right amount of alcohol that's in the final product. Too much alcohol could cause your skin to dry out, but too little alcohol would render it ineffective because it wouldn't kill all the germs. Now, experts have said, though, that the best method to keep your hands clean and kill all the germs is simply one of the easiest methods. So let's have a listen to what he said.
that if you want to disinfect your hands, washing with soap and water is definitely the best method. But having said that, hand sanitizers are useful, particularly the alcohol-based ones. We have to be careful because ultimately how effective a hand sanitizer is really depends on the concentration of alcohol. You need a concentration of at least 60 to 70%. And when you're making this homemade DIY hand sanitizers, you really have to be very, very certain that ultimately your hand sanitizer is effective, because otherwise it might lead to a false sense of security. There are other issues. Firstly, the raw ingredients that you use to make hand sanitizers, for example, rubbing alcohol, they're highly flammable, so you have to be very careful even in the preparation phase.
That's right. So as we just heard, the best method is the simplest one there is, to just use soap and some water and to allow.
The uncertainty is how long this COVID-19 lasts.
Between the fingers there now. So guys, in light of this COVID-19 outbreak, it's really important to keep up your personal hygiene, to wash your hands, to keep them clean and dry, and also to avoid touching your face. It's also important to practice social responsibilities, to stay at home if you're unwell and avoid large gatherings. And if you do go out, to practice social distancing. But till then, keep your hands clean, guys.
The weather's up next, and after the weather, Asia Now continues with the news. Stay with us.
Could actually accelerate to the size as big as the Lehman shock, Great Recession.
Mr. Okubo, let me go back to the issue of the latest development in the D.C. Now, the U.S. senators and President Trump, they have reached an agreement on a massive economic stimulus bill to alleviate the economic impact of the coronavirus outbreak. White House official Eric Uland said early on Wednesday that trillions of dollars would be pouring into the market despite the quantitative easing. So what do you think of such options that are put on the table?
Right. So I do believe that this monetary policy reaction, fiscal policy reaction, I think this is actually coming sooner than probably expected. I think Federal Reserve was very quick to react by slashing rates. And I do believe this talk of potential tax cuts and the size of the fiscal stimulus, this is actually sizable. And that's why financial markets are rallying yesterday and today. So I think these policy reactions are still, so I think financial market is saying that they actually feel, they don't think there's imminent threat of a Lehman shock size recession. So I think these aggressive policy intervention is really helping to prevent what could be a mild recession from developing into a much greater recession.
Thank you very much. That's Mr. Okubo. Let me go back to Jeffrey Towson. The U.S. Federal Reserve announced on Monday that it would buy as many treasury bonds and mortgage-backed securities as needed to support smooth market functioning. Will the Fed's limited quantitative easing show up the U.S. economy, and what does it mean for the rest of the world?
Right. I mean, this is, we're getting into monetary policy, which is a bit out of my area of expertise, but, from my understanding is, it's clear the economic activity is slowing down dramatically. It has to, because we're all sitting at home. At what point does that tip into a liquidity crisis? At what time does that tip into a financial crisis? So, just making sure the Fed is moving money in there in various forms is going to be important. But I don't know what the point is at which the economic slowdown turns into something more acute and rapidly expanding like a financial crisis.
Thank you so much for being with us. And that's Mr. Okubo, economist from the Economist Network based in Tokyo, and Professor Jeffrey Towson, who teaches at the Peking University here in Beijing. Thank you both for being with us. I'll see you next time. Goodbye.
This is CGTN, China Global Television Network. Live from Beijing, this is Global Watch.
Hello and welcome to Global Watch on CGTN. I'm Li Dongning. Well, first of all, the headlines of the day. The U.S. agrees on its largest ever stimulus package to fight the coronavirus as New York reports over 30,000 cases. And Spain's COVID-19 outbreak becomes the world's second deadliest. But there is a glimmer of hope in Italy as new cases drop. And we bring you the latest measures to fight the pandemic across Asia as India and Malaysia impose strict controls. And we look ahead as the G20 hosts an emergency summit to deal with the fallout from the coronavirus. Well, we start with the latest numbers on the coronavirus pandemic. More than 470,000 people have been infected in over 170 countries and regions. Over 21,000 people have died. And Europe and the United States have seen their cases surge. Italy has the highest death toll in the world at more than 7,500, and over 74,000 people have been infected in the country. Spain's death toll has overtaken China's with over 3,600 deaths, and the country now has over 49,000 confirmed cases. The United States has reported more than 15,000 new cases, bringing the total to over 68,000. And Iran has reported over 2,000 new cases with over 140 new deaths. And on the Chinese mainland, there are no reports of new domestic cases, but 67 imported cases have been confirmed in 13 regions, and that includes 6 in Beijing and 18 in Shanghai. In Hubei province, where the outbreak began, active cases have dropped again to less than 3,500. And nearly 400 patients were discharged from the hospital on Tuesday. 6 more deaths have been reported. In the U.S., the Senate has passed a $2 trillion stimulus package aimed at helping Americans during the outbreak. And it's the largest stimulus deal in the country's history and comes as businesses shut down and the pandemic threatens to cripple economies around the globe. CGTN's Jim Spellman has more details.
Here's what we know about what is in the Senate version. Americans who make up to $75,000 a year would receive a check for $1,200 each. That amount goes down up to an income of $100,000. People who make more than that won't receive anything. There's $367 billion in a loan program for small businesses and $500 billion for specific industries, including the airline industry, plus to help cities and states. There's also money for hospitals, as well as expanded unemployment benefits. Here's what the top Republican in the Senate had to say.
At last, we have a deal. After days of intense discussions, the Senate has reached a bipartisan agreement on a historic relief package for this pandemic. It will rush new resources onto the front lines of our nation's healthcare fight, and it will inject trillions of dollars of cash into the economy as fast as possible to help American workers, families, small businesses, and industries make it through this disruption and emerge on the other side ready to soar.
President Trump now saying he would like to see at least parts of the U.S. economy reopened by Easter Sunday. That's just about 2.5 weeks from now. President Trump arguing that the economic damage done by the COVID-19 outbreak could be more damaging than the virus itself. The White House proposing perhaps reopening the economy to workers under a certain age or in certain parts of the country that are less affected by the outbreak.
I want to encourage everyone to keep following our guidelines on social distancing, avoiding large gatherings, and hand washing and all of the other things that everybody knows they're supposed to be doing. Ultimately, the goal is to ease the guidelines and open things up to very large sections of our country as we near the end of our historic battle with the invisible enemy. It'll go on for a while, but we win. We'll win.
But in hot spots like New York City, the situation gets worse by the day. Public health officials saying the only way to stop what's happening in New York City from happening in other cities across the United States is to continue on with these social distancing measures. Those public health officials are skeptical whether Easter Sunday is a reasonable time to expect large parts of the U.S. economy to reopen. Jim Spellman, CGTN, Bethesda, Maryland.
While staying in the U.S., the state of New York is being described as the new epicenter, reporting over 30,000 cases and 280 deaths, and that's just under half of all cases in the United States. Timothy Warwick reports.
The once bustling Times Square looks more like a ghost town as New Yorkers fight the coronavirus.
Everybody's doing that sort of do-si-do on the street, and I'm very proud of New Yorkers. We're trying desperately not to get sick.
The state's also facing a shortage of ventilators on top of a major outbreak, with New York Governor Andrew Cuomo pushing the federal government for more.
We need, at a minimum, an additional 30,000 ventilators. You cannot buy them, you cannot find them. Every state is trying to get them, other countries are trying to get them. The capacity is limited.
The federal government has pledged to send an additional 4,000 ventilators, far below what Cuomo says is needed. Cuomo has also put the long-term impact into focus, blasting a proposed $2 trillion stimulus bill. He called it terrible and argued it doesn't do enough for the hardest-hit state. And New York City Mayor Bill de Blasio also criticized the bill for not giving enough to the country's hardest-hit city.
They gave us less than 1% of the money that they were giving out to cities and states, and we have a third of the cases in the nation. That is just immoral.
The future of the world's financial capital remains uncertain as cases continue to climb, which could spell doom for the global economy. Timothy Ulrich, CGTN.
Well, the rate of new cases in Italy has slowed for a fourth day in a row, and the WHO expects the cases there to peak this week. And this seems to show the lockdown measures against the pandemic will work. Alex Fraser reports from Milan.
The WHO spoke to Italian media, and they're saying that they're expecting the cases here to peak this week, and then they hope they will then fall. They think that that's the effects of this nationwide lockdown, and that we're going to feel that by day 15 to 20. Today is 2 days since that lockdown began. They actually think that the measures have been a good thing, that they've helped to control these numbers, but you're still seeing huge numbers here in Italy. And that is genuinely because they believe a lot of the transmission has happened before this lockdown. It's not to say that everybody has been following the lockdown here. Some people have been disobeying and going out. It's obviously very difficult to be locked down for a long amount of time. But in general, I believe the WHO have been very positive about how the lockdown has gone.
And earlier we spoke to Dr. Valerio Mogini, the head of Italian Red Cross Public Health. He explained some key challenges that the Italian hospitals are now facing and why the mortality rate of COVID-19 cases has been so high there.
The situation is getting harder in all Europe. What we are facing now it is that our health facilities, hospitals are mostly overwhelmed in Italy, mostly in the northern Italy, and we are doing our best to face this situation, which is pretty much challenging. In northern Italy, hospital has been reorganized to take care of the COVID patients, and different hospitals are taking care of non-COVID patients. What we are struggling with, it is the high number of patients that are in the intensive care units. As the high death rate of Italy is concerned, we believe that probably it is due to the fact that we are not testing no symptomatic people, and so probably the number of infected is much higher of the one that we are detecting. We are not testing the whole population. And so we just test the people who have symptoms or people who are a strict contact of people with COVID-19. So it means that probably we are not detecting all the cases. As we are not detecting all the cases,
and faces the prospect of spending the rest of his life behind bars. Prime Minister Jacinda Ardern says she is relieved by the plea, adding the admission of guilt will help provide accountability over this incident. Taryn's actions have also prompted her to tighten New Zealand's gun laws and launch a campaign to curb online extremism.
The whole nation, but particularly our Muslim community, are being spared from a trial that could have otherwise acted as a platform. Nothing will bring their loved ones back, but this is a small reprieve.
China plans to dispatch more medical experts to countries affected by the coronavirus. This comes after the worst-hit country by COVID-19 has seen recoveries in recent weeks.
继续同世界社会组织开展有效合作，以多种形式同国际社会来共同分享抗疫的经验，向有关国家提供技术支持，发挥负责任的大国作用，通过携手抗击新冠病毒疫情，推动人类命运共同体的建设。
The Chinese government has announced assistance to 83 countries and organizations. Supplies such as test kits, masks and protective suits have been sent from China. In the press conference held this morning, officials also pledged to roll out financial support to shore up Hubei's economic growth. The U.S. Senate has unanimously passed the $2 trillion coronavirus economic stimulus bill. They've sent the legislation to the House of Representatives, who will vote on this on Friday. It's the nation's largest ever rescue package, a $2 trillion lifeline to suffering Americans, depleted hospitals, and an economy all ravaged by the rapidly spreading coronavirus crisis. Apologies for that. We'll bring the audio line back when we do get it. Time now to check on market movements across Asia. Here in Singapore, equities sank in early trade after authorities flagged a deep recession. The benchmark STI erasing gains made from Wednesday. Singapore Airlines on a trading halt pending an announcement. It's been a choppy trading session in China. Mainland indices in Shanghai and Shenzhen both down at this point. Hong Kong stocks kicked off on a slightly more positive note, now completely flat, neither up nor down. They're struggling to keep that two-day rally fueled by the U.S. stimulus deal. Elsewhere in Asia, Japan stocks flashing red on profit-taking after surging in recent sessions. Both the Nikkei and the broader Topix index dipping into negative territory. South Korea's Kospi buoyed by the central bank's announcement that it will pump cash into money markets, relaxing FX liquidity rules for banks for 3 months. It's now up almost 1%. Down under, shares in Australia saw early gains, a third positive start this week. The ASX 200 now up 3.38%. New Zealand is the top gainer in the Asia Pacific this morning. It's still soaring high at this point, up almost 4%. There's a mixed picture in Southeast Asia. Stocks trading mixed as investors watch developments in the U.S. With lawmakers working on that massive stimulus package we just heard. The Senate has cleared the vote to rein in the impact of COVID-19. In the forex space, the US dollar giving up strength as investors worldwide brace for a surge in US jobless claims. Here in the Asia Pacific, we are seeing weakness against a basket of currencies. The dollar currently dipping against the Japanese yen and the Korean won. A dollar sell-off taking place as the US relief bill helped to boost risk appetite in the stock market and reduce demand for haven currencies. The Australian and New Zealand dollars, both of which are closely linked to the global commodity trade, falling against their US counterpart. As a recent shortage of US dollar sweeps the globe, pressures are being seen in Asia's emerging markets. Those with significant budget and current account deficits like Indonesia and India, particularly vulnerable. But as of today, the greenback easing against the Indonesian rupiah, the Indian rupee, as well as the Malaysian ringgit. Here in Singapore, the Singapore dollar now trading, you can see there, against the US dollar. Earlier, we spoke to IG Asia market strategist Pan Jingyi about recent weakness seen in the Singapore currency and its outlook looking forward.
Yeah, well, so I don't think on the very minimum that we are perhaps looking at, it's actually, well, a flattening of the slope. I think we've certainly seen, the Sing dollar itself weaken quite substantially, and that itself, including the senior itself, is seen, the Sing dollar trading in the lower half of the band itself. So I think on that end, the weakness itself, I think, it's going to translate a little bit more towards a less or at least no appreciating perhaps for our same currency against the basket of currencies itself. And I think that will certainly see to a little bit of a help as well. Some are expecting perhaps a little bit more extreme measures, but on this end itself, I think definitely at the minimum, we're going to see a little bit of an easing of the policy over here. So on that end itself, I think it's really about we're seeing a bit of a working hand in hand between monetary and fiscal policy here in Singapore.
India e-commerce firm Flipkart will resume sales for essential products after receiving assurances from the government for the safe passage of both delivery workers and supplies.
I believe ever passed in Congress. Perhaps, relatively speaking, if you go back, look during the FDR New Deal days, there was something that if you time value it, you could say it was bigger. I don't know. But this is certainly, in terms of dollars, by far and away the biggest ever done. And that's a tremendous thing because a lot of this money goes to jobs, and families. The Senate bill, as you know, includes $350 billion in job retention loans for small businesses, with loan forgiveness available for businesses that continue paying their workers. They continue paying their workers. That's what we want. We want them to keep their workers and pay their workers. This will help businesses keep workers in the payroll and allow our economy to quickly accelerate as soon as we defeat the virus. $300 billion in direct cash payments will be available for every American citizen earning less than $99,000 per year. That would be $3,400 very quickly for the typical family of four. Nothing like that's ever been done in our country. Up to $250 billion in expanded unemployment benefits. The average worker who has lost his or her job will receive 100% of their salary for up to 4 full months. Unlike normal unemployment benefits, independent contractors and the self-employed will be eligible. So you have independent contractors and self-employed people will be eligible for this. Over $100 billion to support the heroic work of our doctors, nurses, and hospitals. They've been incredible. $45 billion for disaster relief fund. So we are setting up a fund of $45 billion for disaster relief. That's more than doubling the amount available to support my national emergency and disaster declarations. It's a doubling up. $27 billion to build up the strategic national stockpile with critical supplies, including masks, respirators, pharmaceuticals, and everything you can imagine, because it was very depleted, like our military was depleted. Now we have a brand new military. Never had a military like this. We have equipment either coming or it's already come. For the most part, it's already come, but we have a lot of things that will soon be coming. Planes, missiles, rockets, lots of things. But the stockpile was very depleted, like everything else. This will also include significant funding for the development of vaccines on top of the $8 billion we approved several weeks ago. Over $500 billion in support for the hardest hit industries, with a ban on corporate stock buybacks, which is something I insisted on. And frankly, I tell you, the Republicans wanted that and the Democrats wanted that. We want them to use the money for the companies and the planes or whatever they may be helping to get over this rough patch. And I don't think it's going to end up being such a rough patch. I think it's going to, when we open, especially if we can open it, the sooner the better, it's going to open up like a rocket ship. I think it's going to go very good and very quickly. And you're going to have some tough new limits on executive compensation also. They need the money. They're going to have to sort of just make things work, because we're interested in the workers, the jobs. And we're interested in the companies because that's really what fuels the workers in those great jobs. And we also have $16 billion in funding for the purchase of personal protective equipment. You know about that, such as masks and respirators through the Strategic National Stockpile. I encourage the House to pass this vital legislation and send the bill to my desk for signature without delay. I will sign it immediately. We will have a signing, and it'll be a great signing and a great day for the American worker and for American families, and frankly, for American companies, some of which were having the best years they've ever had these last few years. And then a little bit less than a month ago, they went into a position that they haven't seen because of the hidden enemy, the virus. Earlier today, I spoke to the leaders of many of America's amazing nonprofit organizations. I thank them for their unwavering devotion to American people, to American families, to our nation. And they have been fantastic. They've been collecting supplies, distributing food, supporting healthcare workers, caring for vulnerable workers and families. I encourage them to continue to do it. But I'll tell you, the nonprofits have been fantastic. They've been great. They're great people, actually. I know a lot of them. Finally, I want to provide a brief update on the critical supplies. Through FEMA, the federal government has delivered or is in the process of shipping 9.4 million N95 respirators. Think of that, 9.4 million. 20 million surgical masks, and we have others that we think are going to be delivered pretty quickly. The whole world, you know, it's not just us, it's not just the states. The whole world is trying to get these things, so in competition with many, many countries. I believe today you broke the 150 mark for the virus. We have 150 countries, over 150 countries where you have this virus. And nobody would ever believe a thing like that's possible. Nobody could have ever seen something like this coming. But now we know, and we know it can happen and happen again. And if it does, somebody's going to be very well prepared because of what we've learned and how we've done. It's been incredible how we've done. Remember, there's more tests than anybody by far. And the news, the reporters, the media always likes to bring South Korea. They called me and they told me, it's amazing, your testing procedures are amazing. Plus, we have a test that's a very high-level test, and it's a test that's very accurate. 3.1 million face shields, 2.6 million surgical gowns, 14.6 million gloves, and almost 6,000 ventilators, which go to the areas of greatest needs. We sent, over the last day, 4,000 ventilators to New York. And I spoke with the governor about that. He was happy. I spoke with the mayor also about that, Mayor de Blasio. He was very happy. It's hard not to be happy with the job we're doing, that I can tell you. Throughout this national emergency, everyday heroes continue to step forward and demonstrate the extraordinary character of our nation, including the people behind me. By the way, these people are amazing. They are amazing people, and they become, I don't know, maybe I should just speak for myself, but to me, they become friends. Maybe they don't like me. Maybe they don't. Maybe they do. I don't know. All I can tell you is they're talented people. They work very hard. In Maryland, a 7-year-old boy used his own birthday money to buy meals for dozens of senior citizens. In Nevada, a college student recruited 90 of her friends to help deliver groceries and supplies to the most vulnerable. This is happening all over the country, thousands and thousands of instances. I could stand up here all day and tell you about other things. In Minnesota, hundreds of medical students have volunteered to provide child care for hospital workers, helping to keep our doctors and nurses on the front lines, fighting to save lives. These inspiring Americans remind us that we all have a role to play in winning this great national battle, and it's really a worldwide battle. We're dealing with other nations all the time. The people here are, I am a little bit, I take calls from a lot of people. They're in trouble. A lot of countries are in big trouble. So now we will hear from our great Secretary of the Treasury. He's been working rather hard, I will tell you. Steve Mnuchin is a fantastic guy, and he loves our country, and he's been dealing with both sides, Republican and Democrats. He sort of lived over in that beautiful building. It's a very beautiful building. To me, one of the most beautiful buildings actually in the world, and he's gotten to know it, Steve, very well. So if we could have a little update, Steve, would be fantastic as to how we're doing and what it's looking like. Thank you.
Thank you very much, Mr. President. And first, let me say, I would like to thank Mitch McConnell for his leadership, and I'd also like to thank Chuck Schumer for the enormous bipartisan support we had on this bill, and the many senators, both Republicans and Democrats, that worked tirelessly over the last 5 days on all the task force. As the President said, I got to live in the LBJ room for the last 5 days, and we couldn't be more pleased with the unprecedented response from the Senate to protect American workers and American business in this situation. The President has outlined many of these, but let me just quickly go through them. Again, small business retention loans. This will cover roughly 50% of the private payroll in small businesses, where we will immediately make loans that will supply 8 weeks of salaries as long as they keep workers employed and overhead. And those loans will be forgiven at the end of the period as long as they keep workers employed. These are SBA loans, but the Treasury will be issuing new regulations authorizing almost every single FDIC-insured bank to make these. I expect by the end of next week, we will have a very simple process where these can be made and dispersed in the same day. So this will be a very simple system to get money into small business hands. For companies that don't qualify that, we have a economic program of tax incentives to retain workers. And as the President said, we have enhanced unemployment insurance for people who don't fit into these two programs that will be administered through the states. We also have economic impact payments. These will be within the next 3 weeks, direct payments into most people's deposit accounts. And for those that don't have it, we will be having the checks in the mail. Treasury will have additional authorities. We have $500 billion that we can use to work with the Federal Reserve for emergency programs that will create up to an additional $4 trillion, if needed, to support American business and American workers in an unprecedented way. And then finally, the President mentioned $100 billion to hospitals and $150 billion to states that have specific coronavirus expenses, as well as many additional things. Mr. President, I especially want to thank you and the Vice President. You were constantly available to us. We spoke constantly throughout the day. You gave us guidance and quick decisions on many issues. And again, thank everybody for this great bipartisan work. This is going to be enormous help for the American workers and the American economy. The President was very determined that Congress would move swiftly to protect hardworking Americans in business in this unprecedented situation.
Thank you very much, Steve. Great job. Day and night, right? Day and night. That was a lot of work, and we'll see how it all goes. We still need a vote, Steve, don't we? Do you have a question? Yes.
praising his own administration and his own handling of this situation here, saying that the U.S. has given more tests than South Korea did. The U.S. doing in 8 days what South Korea did in 8 weeks. Of course, that ignores the fact that South Korea has 1/6 the population. Per capita, they certainly did a lot more. But the president also notably said that he will be signing immediately, in his words, that emergency relief package, more than $2 trillion, even as there is some infighting on the Hill as we speak right now over this deal. The Treasury Secretary, Steve Mnuchin, saying he's confident that senators will pass it tonight. It would go to the House and then would arrive on the president's desk. Lester?
And, of course, one of the big questions, Peter, is will it be enough? None of us, of course, knows how far this goes. And as he noted, New York City right now is continuing to bear the brunt of it, although there was some encouraging signs that maybe all the restrictions on public gatherings may be having a dent. We'll explore that on Nightly News. We'll continue to monitor this White House briefing as we conclude this special report. For many of you, NBC Nightly News is up next. We hope you'll stay with this NBC station for continuing coverage. For now, I'm Lester Holt, NBC News, New York. Good day, everyone.
Hi, everyone. I'm Gadi Schwartz. You're watching NBC News Now. And while we all practice this social distancing, there is something to be said about being able to give you the latest news from around the world, from our living room to yours. A very real reminder that even though the world seems very far apart right now, we are all in this together. And on that note, it has been another busy day of nonstop COVID-19 developments. So let's go to NBC News Now correspondent Alexa Lioto for the latest coronavirus headlines from NBCnews.com. Alexa?
Hey, Gadi, that's right. And I'm in my living room. We are back with some more headlines as this coronavirus news continues to unfold around the world. And as you mentioned, here at home as well. So first up, the Senate has reached a historic deal on a stimulus package to address the economic impact of the coronavirus pandemic. That's the latest from our Capitol Hill reporting team, and we'll keep you updated as it moves its way through Washington. Now, from NBC News' David Lee, Minnesota becomes the latest state to issue a stay-at-home order. The governor, Tim Walz, saying on Twitter that bold action is needed to protect the residents of Minnesota. That's about 5.6 million people, and the order, like many other states that we've seen across the country, includes the closure of non-essential businesses. And meanwhile, from NBC News' Phil McCausland, President Trump has approved disaster declarations for a number of states, today opening up federal funds for Florida and Texas to combat the coronavirus outbreak in their communities as the number of confirmed cases continues to rise. And more globally, the World Health Organization today encouraged
the last thing any country needs is to open schools and businesses only to be forced to close them again because of a resurgence.
That was him right there, noting also that over 150 countries still have fewer than 100 cases, and he mentioned that they could potentially still prevent community transmission. NBC News' Janelle Griffith reporting on Louisiana, where a pastor is defying state orders as well as CDC guidelines by hosting over 1,000 people at a church service on Sunday. A spokesperson for the National Guard in Baton Rouge told NBC News that it has no role in enforcing social distancing orders that were mandated by the governor. The total number of cases in Louisiana is rising. More than 1,700 cases of coronavirus have been reported in the state as of this afternoon, and that does include 65 deaths as well. Hundreds of police officers on the front lines are being exposed to coronavirus. That's the latest from NBC News' John Shupe. The data on how the virus is spreading through American law enforcement agencies is being tracked by the National Police Foundation. It does not include data from the NYPD, of course, the nation's largest police force, where more than 100 officers have tested positive, and that's reporting from NBC News' investigative correspondent Tom Winter. And last up, some good news from the private sector. Apple CEO Tim Cook made this announcement earlier.
I'm also very pleased to tell you this morning that Apple has sourced, procured, and is donating 10 million masks to the medical community in the United States. These people deserve our debt of gratitude for all of the work that they're doing on the front lines.
Cook joins several other tech leaders in making donations to help communities impacted by the coronavirus pandemic. Doctors and nurses around the world, including in the United States, have been calling for help repeatedly amid shortages of personal protective gear. And those are the latest headlines this early evening. Gotti, back to you.
Thanks so much, Alexa. A lot of questions that we're hearing from our viewers, a lot of questions that we have as well about the coronavirus. With NBC News medical contributor Dr. Natalie Azar with us right now. Dr. Azar, the president this week, you've heard him calling for the country to reopen sooner rather than later. We've heard mixed opinions, but it seems like the medical profession and the World Health Organization cautioning against opening schools and businesses too soon. The question is, how soon is too soon?
Yeah, well, look, I read a very interesting article maybe a week ago, which said from experts that let's say that literally everyone in the U.S. stayed home for 2 weeks, which is what the incubation period, you know, the upper limit of the incubation period that we know of. What would happen? Well, the virus would no longer be circulating, right? Because it needs people to circulate person to person to person. And if everyone who's sick stays alone, everybody, or you know what I mean, isolated, and everyone who's healthy doesn't interact with anybody else, then effectively the virus would be gone. And it would only be a matter of time before it would resurface. Governor Cuomo's made a very interesting point today, and he said that the density control plan appears to be working in New York City based on one model, and he said not all models are perfect. And he justified that by saying that on Sunday, the hospital rate was doubling every 2 days, hospitalization rate. By Monday, it was doubling every 3.5 days. And by Tuesday, it was doubling almost every 5 days. So we were already seeing, we're hoping that that's a little indication that this whole plan of social distancing has done what it was supposed to do, and that is to limit the onslaught in the hospitals. But if we stop that, and he, by the way, also said that he expects our peak in New York to happen in 21 days, which is past the, I think it's 18 days now until Easter, which is past that mark. So yes, there is no real sound reasoning in this. We're all going to start congregating again in 2.5 weeks. That's not based on any, scientific evidence or any scientific rationale that I've heard of, or that the experts are talking about.
Now, what steps do we need to take as a country other than staying at home to get to the point of reopening? I mean, is that basically it? Like you were saying, kind of freeze everything as much as possible and wait for the virus individually to die out on itself?
Sort of the kinetics of the virus. Look, here it is overwhelming. And I have heard infectious disease specialists from other institutions say maybe it's not the right thing to do to shut everything down, because what happens if this coronavirus becomes seasonal? What are we going to do next year? Are we just going to close everything down again? I might be answering your question with more questions than answers, to be honest, Gotti, but another point that Dr. Fauci makes is that we talk about these densely populated areas, and it makes a lot of sense that in New York, in the metropolitan area, and now in New Orleans, you got to really close things down. The social distancing is the most important tool that we have in the toolbox. But then people say, well, what about other parts in the country that aren't as sparsely populated? But Dr. Fauci made a really important point about this and said, without testing, either viral testing or serologic testing, we don't really know the true penetrance in those parts of the country that we think might be okay to, to let go of the restrictions of that social distancing. But we might do that, and then suddenly we're just going to start seeing the cases because the virus may in fact be there. So I don't have a good answer for you other than let the public health experts, let the scientists, let the epidemiologists guide us in this. This is what they do. And we should be, we should feel confident in their recommendations and try to follow them as best as we can. And right now that is social distancing.
And right now we've seen this confirmed number just skyrocket in places like New York, like we were just talking about. Is that because in New York, the virus is spreading very quickly, or is it because people are getting more tests, or is it a combination?
It's a combination. I don't think I haven't heard any other theories. There's no reason that it should be, more contagious here than anywhere else. So I think it's a combination of, we're picking up cases and it's a densely populated area, and we know it can be transmitted with mild symptoms that are not necessarily telltale, and also when people are asymptomatic. So it's not surprising given the amount of public transportation and, close business quarters and living quarters that we all, that our world, revolves around in New York.
And Doctor, one of the things that we've been following is the FDA is now allowing the use of something called convalescent plasma to treat coronavirus. We've heard of plasma, but what is convalescent plasma?
Yeah, so convalescent sera or convalescent plasma is this concept that once you have recovered from an infectious disease, your body has made antibodies. A common example of that would be if you've had mono, you will have antibodies in your blood that are detectable against Epstein-Barr virus, which is the virus that causes mononucleosis. So in someone who's recovered from an infectious disease, we are able to actually take their blood, spin it down. The plasma is the thing that is the part of the serum that contains the antibodies, and we don't use the red blood cells or any of the other blood products. Those antibodies in that sera, in that plasma, can be an effective tool to actually treat people who are currently and acutely infected. And 2 institutions in New York have now started to recruit recovered patients for their plasma, for their sera, Mount Sinai and Albert Einstein, and in the hopes of actually treating patients now. And I think nationally, clinical trials are also going to be done to see just how effective it is. It was something that was done during the Ebola outbreak and during SARS, I think with varying degrees of efficacy, but it's always something that is enticing. The blood has to be screened, of course, the blood typing, and it's screened for other, infectious diseases, of course, hepatitis, HIV, that kind of thing. But it's a pretty benign intervention, without a lot of known side effects that I am aware of. So that's happening now.
So convalescent plasma, that doesn't include anything outside of your own body, basically. It's not like taking a virus from outside and bringing it in, right?
No, not at all. It's literally taking just the antibodies that were formed against the virus.
Okay. And we've got a lot of viewer questions coming in about vitamin C. Something simple like vitamin C, can that prevent or cure coronavirus?
So here's the rationale as I understand it, and I was trying to sort of get as up to date as I could about this, is that part of what can lead to people's death in this disease, as in other raging infectious diseases, is not even so much that the virus can directly affect the lung causing pneumonia or, the heart or something like that, but rather that it's your immune response that becomes so robust and so hyperactive that can end up actually causing sepsis and multi-organ failure, and that's why people die. And so there's thought that, or there was some evidence that vitamin C levels go very, very low when that happens. It's called a cytokine storm, that hyperactive immune system. And so the rationale is that if that's the case, that if you then supplement with high doses of intravenous IV vitamin C, that could maybe correct some of that immune hyperactivity. There was a clinical trial that was started in China on February 14th, but apparently there's no real data from that yet, none that I have seen. Perhaps it's out there. I was not privy to it. And there is apparently some hospital systems in New York that are doing it. They are giving high-dose intravenous vitamin C. If you ask other experts, they'll say, well, maybe there's marginal benefit of vitamin C and maybe lessening the severity of colds and flus. There's no direct evidence, again, that anyone knows that it's specific to COVID-19. Is it a fairly benign intervention in the hospital setting? Yeah, I mean, they're giving 1,500 milligrams of IV vitamin C, and then I think they repeat that dose. Just so for people to understand this, that's about 16 times the recommended daily allowance of vitamin C. For most folks, it's 65 to 90 milligrams every day. So they're giving a lot on top of that. which is not something that I don't think anyone would recommend that somebody do as an outpatient without proper, doctor supervision. The good thing about vitamin C is that there's very low acute toxicity with it. Usually whatever's not used is excreted by the kidney and can cause GI upset if too much is taken. But certainly no, CDC and World Health Organization has not recommended this as a therapy. I think it's experimental and it's interesting, but we have no conclusive data on it.
And Doctor, with a lot of us having a lot more time to sit on the couch and stream, I'm one of those idiots that decided it was a good idea to watch Contagion in all of this. Is there a chance that we could see this virus mutate and possibly see a second wave, a very different virus come back a little bit later?
Well, viral mutation is always a possibility, but the experts that have been studying this particular coronavirus, there is no indication that it has mutated, and certainly not mutated. Well, there's two different strains right now that are circulating, but that sort of genetic diversity has not translated into any clinically meaningful distinction, meaning that there's no more virulent strain that's out there or anything like that. In fact, we're thinking that it's not mutating, which is a good thing, because in the hopes of making a vaccine against this particular COVID-19, we don't want to be in a situation like we are with influenza, which mutates all the time, and we need to make a new vaccine every year. That hopefully, if we do, in fact, if we are able to make a vaccine, that it's one that we could use forever, or that that gives more lifelong or at least prolonged immunity, and not just, seasonal or annual, the way it is with the flu.
Dr. Natalie Azar, with a very cozy looking fireplace behind you, thank you so much for joining us.
Thanks, Scotty.
If it's digging in on the issues.
Let's talk about money and politics.
If it's asking the questions you want to ask. How do you reassure those supporters that you will sustain this?
Just watch me.
If it's navigating the winding road to the White House. And if it's Sunday, it's Meet the Press.
Need your true crime fix on the go? Dateline episodes are available as podcasts. Mysteries with a twist from the True Crime Original. Wow. Listen to Dateline wherever you get your podcasts.
Breaking news tonight, the deadliest day yet of the coronavirus outbreak in the U.S. Over 200 dead in 24 hours. New York City, now the nation's epicenter. Long lines at hospitals, makeshift morgues being arranged. U.S. cases surging to over 60,000. The new hotspots cropping up. Deaths rising in New Orleans. Is Mardi Gras to blame? While Florida and other states won't issue stay-at-home orders. Also, hospitals under siege, many already at capacity. Inside the secret stockpile one top hospital tapped into. And a growing number banning visitors, with more pregnant women considering home births. The risks you need to know. The Senate deal for the largest relief package in U.S. history. What's in it? And what's the quickest way to get your check? And the late word tonight from the White House after the president said he wanted to reopen the economy by Easter. And will the relief package be enough to rescue businesses? Unemployment skyrocketing. New safety measures at grocery stores as some are forced to shut down. The new warning about defying orders to avoid large gatherings.
God gave you a brain, and he expects you to use the intelligence that you are given.
The pastor with an urgent plea and the new treatment that could save patients in critical condition.
This is NBC Nightly News with Lester Holt.
Good evening, everyone. I hope you're watching us safe and at home. Here in New York, the current American epicenter of this pandemic, the first data tonight suggesting that maybe, just maybe, social distancing is helping to slow the onslaught of coronavirus. And yet officials say the worst days are still to come. The numbers are still rising, leaving the region's medical system on the edge of being overwhelmed, and other cities fearing they may very well be next. We've got it all covered. Miguel Almaguer starts us off.
As our country faces a national emergency and scenes like these unfold in communities big and small, tonight.
Breaking news tonight, the deadliest day yet of the coronavirus outbreak in the U.S. Over 200 dead in 24 hours. New York City, now the nation's epicenter. Long lines at hospitals, makeshift morgues being arranged. U.S. cases surging to over 60,000. The new hotspots cropping up. Deaths rising in New Orleans. Is Mardi Gras to blame? While Florida and other states won't issue stay-at-home orders. Also, hospitals under siege, many already at capacity. Inside the secret stockpile one top hospital tapped into. And a growing number banning visitors, with more pregnant women considering home births. The risks you need to know. The Senate deal for the largest relief package in U.S. history. What's in it? And what's the quickest way to get your check? And the late word tonight from the White House after the president said he wanted to reopen the economy by Easter. And will the relief package be enough to rescue businesses? Unemployment skyrocketing. New safety measures at grocery stores as some are forced to shut down. The new warning about defying orders to avoid large gatherings.
God gave you a brain and expects you to use the intelligence that you are given.
The pastor with an urgent plea and the new treatment that could save patients in critical condition.
This is NBC Nightly News with Lester Holt.
Good evening, everyone. I hope you're watching us safe and at home. Here in New York, the current American epicenter of this pandemic, the first data tonight suggesting that maybe, just maybe, social distancing is helping to slow the onslaught of coronavirus. And yet officials say the worst days are still to come. The numbers are still rising, leaving the region's medical system on the edge of being overwhelmed, and other cities fearing they may very well be next. We've got it all covered. Miguel Almaguer starts us off.
As our country faces a national emergency and scenes like these unfold in communities big and small, tonight New York State says it's the canary in the coal mine. Once bustling city streets have become eerily quiet, while lines outside hospitals stretch around the block. Makeshift morgues are being prepared. The governor says in 3 weeks, coronavirus cases will hit their high point.
We still have the trajectory going up, 80% still self-resolved. About 15% of the people who test positive require hospitalization.
While the explosion of new cases in New York are slowing, the city's high density and residents leaving town could exacerbate the spread. Police are warning residents to avoid crowds. Some city streets will be closed to traffic so pedestrians can spread out. Across the country in California, where half as many tests have been taken than New York, the death toll and those infected could easily become the highest in the nation.
We are anywhere from about 6 to 12 days behind what we are seeing in New York City.
Even in our country's most remote state, Hawaii, there is trouble in paradise as new cases skyrocket. More than half the nation has orders for residents to stay home. But some governors, like Florida's, will not issue a state mandate.
To order someone not to be able to earn a paycheck, that is something that I think is inappropriate.
But the World Health Organization says staying at home is vital.
Lockdowns slow down a virus like this. You have got to find those transmission chains, cut them to actually stop it.
Tonight in Louisiana, where the virus is spreading faster than anywhere else in the world, hospitals describe their fight against the illness as a war zone. Our Blaine Alexander is in New Orleans.
Today, Bourbon Street is practically a ghost town, but exactly 1 month ago, more than 1 million people packed here for Mardi Gras. And experts say that is a big reason that numbers here are growing faster than almost anywhere in the world.
The crisis around the globe is grim. While Italy has the highest death toll, over 6,800, Spain has now surpassed China, 700 dead overnight. And just today, word that 71-year-old Prince Charles tested positive for the virus, but has not been hospitalized.
We thought she just maybe had the flu or had a bad cough.
In St. Louis, all 5 members of the Winehouse family contracted the virus. Mom Jane needed a ventilator to keep her alive.
No health issues in her past, no pre-existing conditions whatsoever.
With this California doctor living in a tent outside his home to limit exposure to his family, it's another example of sacrifice as every American faces the same threat tonight.
In cities like New York, social distancing appears to be working, with the number of new cases slowing. That is offering a glimmer of hope. Meantime, here in Los Angeles, we're told the order to stay away from crowds could last as long as 2 months. But Lester, we should point out the vast majority of Americans who get sick do not need to go to the hospital. Lester?
Important to keep in mind. Miguel, thank you. This extraordinary crisis certainly leading to some extraordinary calls to action. For example, New York University graduating some of its medical students early so they can join the battle as more hospitals around the country are besieged. Here's Tom Costello.
From the doctors on the front lines, a sobering reality check on the pandemic. Desperate for supplies, New Jersey doctor Alexander Salerno has set up triage tents to handle 300 patients a day and spent $17,000 buying supplies on the black market at an 800% markup.
They open up the warehouse and you see pallets upon pallets of equipments, gowns, N95 masks, Purell hand sanitizers, Clorox wipes. It's insane. And I'm like, there's no moral compass.
At Brigham and Women's Hospital in Boston, critical care doctor Daniela Lamas knows the devastating impact of not allowing visitors to the hospital.
I'm worried about my patients taking their last breaths alone. I worry about this at the same time that I acknowledge that this is actually what we must do in today's climate with this illness.
At New York Metropolitan Hospital in Harlem, a surge in young patients on ventilators struggling to breathe.
At the present time, we have an adequate number, but the patients that are requiring the ventilator are increasing with each day, and I will need more mechanical ventilators.
New York Governor Cuomo again reiterating his hospitals are in immediate need of ventilators, urging other states to share theirs and promising to reciprocate as the virus rolls across the country.
We're asking for their help and their consideration, and we will repay it with dividends.
Other cities are already feeling the heat. Hospitals in Atlanta and Detroit say they're full. Illinois' governor warns in a worst-case scenario, he'll need another 9,000 ICU beds and 5,000 ventilators by April 6th, double what he has now. NBC's Morgan Chesky is in Miami.
Doctors here in Florida say the low number of confirmed cases does not reflect reality, and that's why this field hospital is being built to accommodate an expected surge of COVID-19 patients.
Meanwhile, at Unshattered, an addiction recovery nonprofit in upstate New York, they're working round the clock, making masks for local medical workers.
We anticipate being able to make about 1,500 masks per week, but we know that we cannot meet this shortage.
One more note, the nation's VA hospitals also say they're seeing older COVID-19 patients, but they insist they're also ready with masks and ventilators. Lester?
All right, Tom, thanks. A health crisis and, of course, a financial one. The economic impact. So many people anticipating that massive emergency aid bill that includes direct payments to most Americans. But tonight, the bill has still not been passed. Peter Alexander has late details for us.
Tonight, the largest economic relief package in U.S. history, more than $2 trillion worth, is expected to get the Senate's green light, despite some last-minute drama.
This is not even a stimulus package. It is emergency relief.
First up, those direct payments to most Americans. For people making up to $75,000 a year, a $1,200 check. Couples making up to $150,000 would get $2,400, plus an additional $500 per child. Next, unemployment benefits rising by $600 a week for up to 4 months, now expanded to include gig economy workers and freelancers. Small businesses also getting a boost. Forgivable loans up to $10 million to keep paying their employees. Also in the deal, $500 billion for corporations like airlines, including new rules on oversight and a ban on stock buybacks. And more than $100 billion for hospitals. New York Governor Andrew Cuomo saying his state that's been hardest hit will get $3 billion, what he says is not nearly enough.
That is a drop in the bucket as to need.
Overnight, new reaction to the president's suggestion that he'd love to have the U.S. opened up by Easter.
We're going to look at it. We'll only do it if it's good, and maybe we do sections of the country.
His top public health advisor, who's warned the outbreak will likely last well past then,
calling the president's timeline an aspirational goal.
He's been very flexible about it. Even though it looks like he's made this absolute decision on something, he does have an open mind about it.
That drama over the bill, a clash over unemployment insurance that still needs to be settled before it goes to the House. The president saying he'll sign it immediately. And as for those checks, you could get them faster if you have direct deposit with the IRS. If not, it could be more than a month by mail. Lester?
All right, Peter, thank you. And that new stimulus package includes hundreds of billions of dollars for small businesses. But will that be enough? Many workers resorting now to desperate measures to get by. Our Gabe Gutierrez reports.
Tomorrow, new national unemployment numbers are expected to shock the system. Likely millions of Americans, like Cheryl Swanson, are filing claims for the first time.
It's a new reality that none of us really know how to deal with.
Laid off from a restaurant in Colorado, she says it took her 6 days to file her claim.
It was next to impossible. A lot of my coworkers didn't even try because they could tell from all of us that it was just maddening.
GoFundMe is launching a small business relief initiative where people can donate online. Across America, the great adaptation is underway. Businesses are getting creative to survive.
Big breath in.
Yoga studios teaching down dog online. Electricians in San Francisco using their vans to deliver groceries.
I think our guys are enthusiastic about it.
From Chicago to Omaha, distilleries now brewing hand sanitizer.
We'll form an assembly line and crank as many out as we can.
But now new concerns about the workforce still on the job. Less than a week after Amazon announced it was hiring 100,000 new employees to meet surging demand for home deliveries, workers in at least 6 of its warehouses have tested positive for COVID-19. And with customers packing grocery stores and pharmacies, employees there are on alert.
It's a chance that I'm willing to take and my crew's willing to take and serve the community.
In some cases, the line for groceries stretches around the block. Some other stores here in the New York area have had to temporarily close after employees tested positive for the virus. Lester?
All right, Gabe, thank you. We'll be back in 60 seconds with an inside look at a hospital pushed to the brink. As the U.S. healthcare system is pushed to its limits, one top hospital has now been forced to dip into the secret stockpile we first showed you earlier this month. Stephanie Gosk takes us inside.
Boston's Mass General was planning for all scenarios, hoping it wouldn't be this one. Coronavirus cases doubling roughly every 2 to 3 days.
I would say this is following our worst case scenario in terms of pace, in terms of how fast this is evolving.
How much transmission has been out there that we're not aware of?
Just 3 weeks ago, they gave us an inside look at their pandemic plan, including a tour of the hospital's own emergency stockpile.
This looks like a lot of stuff to me, but how long is this going to last?
The goal was to give us about a 2-week buffer.
2 weeks?
2 weeks.
That's not a lot of time.
It's not a lot of time.
And now the stark reality. Mass General has already tapped into their emergency supplies, masks, sanitizer, and face shields. The federal government has yet to fill any of their requests.
We're trying, of course, not to use it all right now. We think we are still several weeks away from the potential peak of the outbreak.
The hospital has 150 critical care beds. They are scrambling to increase capacity by turning other units into ICUs.
We can get up to about 300 or so with the extraordinary efforts we've taken.
And then there are the ventilators.
We've identified more than 200 additional ventilators that we're looking to bring on board.
But if they run out, the hospital has a last resort plan.
We can actually take the tip of this and put it on a T-piece to connect it to 2 people if we had to.
People can actually share this?
They can share it in very rare circumstances. We do not do this normally.
Because normally a hospital like Mass General doesn't run out of the supplies critical to saving lives and protecting the staff.
The reality is right now the supply chain just can't keep up with our needs.
And every day, those needs are growing. Stephanie Gosk, NBC News.
A growing number of hospitals are imposing strict measures on who they are letting in their doors, and it's causing anxiety for pregnant women. Here's Katie Beck.
At 8 months pregnant, Carly Bertolino lives in constant fear of contracting COVID-19.
It's a horrible time for all pregnant ladies.
This week, more worry. News from her doctor that she may have to give birth to her first child without her husband in the delivery room.
You picture this milestone since you're a little girl. And not having my husband there potentially it's heartbreaking.
Hospitals across the country drafting new standards to restrict the number of people allowed inside delivery rooms, even limiting the number of in-person prenatal checkups. Several hospitals in New York banning spouses and partners entirely. The anxiety now driving many pregnant women to explore delivering at home or in a birth center.
We're getting swamped.
Calls to midwife Karina Hassel surging.
Every day, all day, into the night, of women asking if they're appropriate candidates for out-of-hospital birth and if we have space.
While giving birth at home may reduce chances of a COVID-19 exposure, the decision to have a baby outside of a medical facility presents a whole new set of risks.
That includes an increased risk for perinatal death, as well as potential neurologic problems with the baby.
And despite the increased demand for home birth, not every woman is a safe candidate for it.
You don't want a midwife who's taking everybody at every cost. This is not the time for us to lower our risk standards.
Still, for Bertolino, the current standard's hard to accept.
Emotionally, and you want your husband to be there if, God forbid, anything happens.
Weighing the new complications of pregnancy, birth during a pandemic. Katie Beck, NBC News.
By now, we've all heard the social distancing guidelines. The vast majority of houses of worship are abiding, but there's an important message tonight for those that are not. Here's Cynthia McFadden.
So many things we never thought we'd see. The Pope watching over an empty St. Peter's Square. Drive-up confessions in Draper, Utah.
The sacrament doesn't change.
Shabbat Shalom. Shabbat services live streamed all over the country. In Jerusalem, the iconic gold dome of the Rock shuttered. But not all religious leaders are on the same page. In Louisiana, a pastor has continued services despite a state order banning gatherings over 50.
We've heard reports from all over the country of some people of faith who say, listen, I don't have to socially isolate. I don't have to stay home. You know, God is going to protect me. What do you say to them?
That's nuts. That's crazy. Let me just say that. That's dumb. It's unbiblical, and it doesn't make sense.
Rick Warren, the pastor of the Saddleback Church with 30,000 Sunday congregants around the world, has never minced words.
God gave you a brain, and he's not going to write it in the sky. He gave you a brain, and he expects you to use the intelligence that you are given.
Warren and his wife, Kay, started Saddleback 40 years ago.
Thanks for meeting in small groups this week.
They've moved their ministry online.
Everything around me can be shaken, but God cannot be shaken.
Does that mean God will protect and heal?
I'm the healed and the devil's trying to give me the flu.
As a Texas evangelical preaches?
Put your hand on that television set.
That's just not faith. That's presumption. God is not a genie. He doesn't serve me. I serve him.
A priest in Grand Rapids serving by populating the pews with photos of those worshiping at home.
Looking at faces, it really took on a whole new meaning for me. It was really profound.
Keeping the faith and passing it on.
This is a time actually for churches to shine and to help the vulnerable.
Cynthia McFadden, NBC News.
And up next, the new hope for critical patients. All right, welcome back. Joining us now is our medical correspondent, Dr. John Torres. John, I know the FDA is allowing a treatment that essentially uses the blood of people who've recovered from the virus to help others. Exactly how does this work?
So, Lester, it's called convalescent plasma, and it's been used in past pandemics. The idea is when a patient recovers from coronavirus, their blood has antibodies that can be used on a patient that's currently infected. This is not FDA approved, but they are allowing doctors to use it on a case-by-case basis, but only for the sickest patients. It's not a cure, but it's a therapy that can be used in the interim while we wait for medicines to be approved in the next 3 to 4 months, and a vaccine, hopefully in a year. Mount Sinai Hospital here in New York is telling me they plan to start using this treatment in the next few weeks.
All right, good to hear. All right, thanks, John. Up next, the power of making people smile. Finally, Kristen Dahlgren and how some kids are bringing a smile to people feeling vulnerable and alone.
At a time when many are feeling helpless, some Long Island kids are doing all they can to help.
Hi, everyone. I hope you're doing well.
and I will be singing Somewhere Over the Rainbow.
Transporting local senior citizens on lockdown to a happier place. Sending videos and pictures through a program called Made You Smile. They say a song can bring people together. Tonight, that may be more true than ever.
I appreciate this. I have 17 grandchildren.
You are my sunshine, For kids and seniors, a ray of light in even the darkest times.
Stay healthy. Bye.
Kristen Dahlgren, NBC News, New York.
Well, they made me smile, and we certainly appreciate them. And a note tomorrow on Today, Savannah Guthrie interviews Fed Chairman Jerome Powell. That's Nightly News. I'm Lester Holt. Thank you for watching. Please take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.
Governors are issuing stay-at-home orders. Here in Florida, population 21 million, that mandate has not been ordered. But we discovered families like the LaFave are doing just that, staying at home. And they say easier said than done. In the age of coronavirus, kids like 9-year-old twins Addison and Aiden have been spending a lot of time at home on the computer studying.
Nothing. I'm bored.
Older sister Kaylee, an 8th grader, is cut off from friends, except on FaceTime.
Yeah, so how's your Corona break?
My Corona break is great.
Now, more than a week into stay at home, the LaFave kids in Central Florida, like adults, say they get it.
It's spreading too fast, and we have to stop it from spreading, so we stay home.
But for you, what's that like?
We take you now to the White House for the coronavirus briefing.
People that does nothing but communicate with the various officials, including we've been spending a lot of time with New York officials because that really is by far the hottest spot. They've got a number of very tough weeks ahead of them. The governor's doing a very good job. I spoke to the governor, Governor Cuomo, last night and this morning, and he mentioned that in his remarks that he's using that we are using, and I think he feels, because he understands negotiation, he thinks we're using very appropriately the Defense Production Act, and we're using it where needed. It's a great point of leverage. It's a great negotiating tool. But I will tell you, there's tremendous spirit from people and tremendous spirit with respect to these companies. And I don't have to use it very much at all. They want to do it. As you know, General Motors is involved, Ford's involved, 3M's involved, others are involved, and they're all working very hard to produce all different products. We had very little product when we came. We built it up, and we give it away as fast as we can to the different states. We're also, as you know, building numerous hospitals and medical centers throughout certain areas. In New York, it's at the convention center, the Javits Convention Center. We're doing 4 hospitals, and we're doing throughout the state 4 medical centers there, somewhat different. I want you to know that I'm doing everything in my power to help the city pull through this challenge. I'm working very hard in New York. It's really, by far, our biggest problem. Maybe it will be, maybe it won't be. But there's a lot of good, capable people working on it with us, and our teams are working very well with the state representatives. We're also doing some very large testings throughout the country. I told you yesterday that in South Korea, and this is not a knock in any way, because I just spoke with President Moon. We had a very good conversation about numerous other things, but they've done a very good job in testing. But we now are doing more testing than anybody by far. We do more in 8 days and they do in 8 weeks. And we go up on a daily basis exponentially. So it's really good. By the way, while I'm on it, I also spoke with Prime Minister Abe of Japan last night, and I congratulated him on a wise choice. I think it's going to be a fantastic Olympics 2021. I think it's going to be a fantastic Olympics. It was the absolute right decision to delay it for a full year and now have a full, beautiful Olympics. It's going to be very important because it's probably the first time, maybe ever, or certainly in a long time, that it was on a odd year. It's always on an even year, they tell me. But he's going to have a fantastic success, and now they'll have even more time. He didn't need any more time. Everything was perfectly ready. What a job they've done. But Japan, I want to congratulate Japan, the IOC, and Prime Minister Abe on a great decision. I think it's going to be a fantastic Olympics. I told him I'll be there. I'll be there. As we fight to protect American lives, we're also protecting American livelihoods. Democrats and Republicans in the Senate are very close to passing an emergency relief bill for American workers, families, and businesses. This legislation, in addition to the two bills I signed this month, that includes, as you know, sick leave, and we have all sorts of things in for the workers, for families. But we have a tremendous paid sick leave provision for workers at no cost at all to the employers. And that's a big thing, no cost to the employers. We want to get everybody back working. Together, this $2.2 trillion legislative package is bigger than anything, I believe, ever passed in Congress. Perhaps, relatively speaking, if you go back, look during the FDR New Deal days, there was something that if you time value it, you could say it was bigger. I don't know. But this is certainly, in terms of dollars, by far and away the biggest ever done. And that's a tremendous thing because a lot of this money goes to jobs, 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 and families, families, families. The Senate bill, as you know, includes $350 billion in job retention loans for small businesses, with loan forgiveness available for businesses that continue paying their workers. They continue paying their workers. That's what we want. We want them to keep their workers and pay their workers. This will help businesses keep workers in the payroll and allow our economy to quickly accelerate as soon as we defeat the virus. $300 billion in direct cash payments will be available for every American citizen earning less than $99,000 per year. That would be $3,400 very quickly for the typical family of four. Nothing like that's ever been done in our country. Up to $250 billion in expanded unemployment benefits. The average worker who has lost his or her job will receive 100% of their salary for up to 4 full months. Unlike normal unemployment benefits, independent contractors and the self-employed will be eligible. So you have independent contractors and self-employed people will be eligible for this. Over $100 billion to support the heroic work of our doctors, nurses, and hospitals. They've been incredible. $45 billion for disaster relief fund. So we are setting up a fund of $45 billion for disaster relief. That's more than doubling the amount available to support my national emergency and disaster declarations. It's a doubling up. $27 billion to build up the strategic national stockpile with critical supplies, including masks, respirators, pharmaceuticals, and everything you can imagine, because it was very depleted, like our military was depleted. Now we have a brand new military. Never had a military like this. We have equipment either coming or it's already come. For the most part, it's already come, but we have a lot of things that will soon be coming. Planes, missiles, rockets, lots of things. But the stockpile was very depleted, like everything else. This will also include significant funding for the development of vaccines on top of the $8 billion we approved several weeks ago. Over $500 billion in support for the hardest hit industries. with a ban on corporate stock buybacks, which is something I insisted on. And frankly, I tell you, the Republicans wanted that, and the Democrats wanted that. We want them to use the money for the companies and the planes or whatever they may be helping to get over this rough patch. And I don't think it's going to end up being such a rough patch. I think it's going to, when we open, especially if we can open it, the sooner the better, it's going to open up like a rocket ship. I think it's going to go very good and very quickly. And you're going to have some tough new limits on executive compensation also. They need the money. They're going to have to sort of just make things work because we're interested in the workers, the jobs. And we're interested in the companies because that's really what fuels the workers in those great jobs. And we also have $16 billion in funding for the purchase of personal protective equipment. You know about that, such as masks and respirators through the Strategic National Stockpile. I encourage the House to pass this vital legislation and send the bill to my desk for signature without delay. I will sign it immediately. We will have a signing, and it'll be a great signing and a great day for the American worker and for American families, and frankly, for American companies, some of which were having the best years they've ever had these last few years. And then a little bit less than a month ago, they went into a position that they haven't seen because of the hidden enemy, the virus. Earlier today, I spoke to the leaders of many of America's amazing nonprofit organizations. I thank them for their unwavering devotion to American people, to American families, to our nation. And they have been fantastic. They've been collecting supplies, distributing food, supporting healthcare workers, caring for vulnerable workers and families. I encourage them to continue to do it. But I'll tell you, the nonprofits have been fantastic. They've been great. They're great people, actually. I know a lot of them. Finally, I want to provide a brief update on the critical supplies. Through FEMA, the federal government has delivered or is in the process of shipping 9.4 million N95 respirators. Think of that, 9.4 million. 20 million surgical masks, and we have others that we think are going to be delivered pretty quickly. The whole world, you know, it's not just us, it's not just the states. The whole world is trying to get these things in competition with many, many countries. I believe today you broke the 150 mark for the virus. We have 150 countries, over 150 countries where you have this virus. And nobody would ever believe a thing like that's possible. Nobody could have ever seen something like this coming, but now we know, and we know it can happen and happen again. And if it does, somebody's going to be very well prepared because of what we've learned and how we've done. It's been incredible how we've done. Remember, there's more tests than anybody by far. And the news, the reporters, the media always likes to bring South Korea. They called me and they told me, it's amazing, your testing procedures are amazing. Plus, we have a test that's a very high-level test. And it's a test that's very accurate. 3.1 million face shields, 2.6 million surgical gowns, 14.6 million gloves, and almost 6,000 ventilators, which go to the areas of greatest needs. We sent, over the last day, 4,000 ventilators to New York. And I spoke with the governor about that. He was happy. I spoke with the mayor also about that, Mayor de Blasio. He was very happy. It's hard not to be happy with the job we're doing, that I can tell you. Throughout this national emergency, everyday heroes continue to step forward and demonstrate the extraordinary character of our nation, including the people behind me. By the way, these people are amazing. They are amazing people, and they become, I don't know, maybe I should just speak for myself, but to me, they become friends. Maybe they don't like me. Maybe they don't. Maybe they do. I don't know. All I can tell you is they're talented people. They work very hard. In Maryland, a 7-year-old boy used his own birthday money to buy meals for dozens of senior citizens. In Nevada, a college student recruited 90 of her friends to help deliver groceries and supplies to the most vulnerable. This is happening all over the country, thousands and thousands of instances. I could stand up here all day and tell you about other things. In Minnesota, hundreds of medical students have volunteered to provide child care for hospital workers, helping to keep our doctors and nurses on the front lines, fighting to save lives. These inspiring Americans remind us that we all have a role to play in winning this great national battle, and it's really a worldwide battle. We're dealing with other nations all the time. The people here are, I am a little bit, I take calls from a lot of people. They're in trouble. A lot of countries are in big trouble. So now we will hear from our great Secretary of the Treasury. He's been working rather hard, I will tell you. Steve Mnuchin is a fantastic guy, and he loves our country, and he's been dealing with both sides, Republican and Democrats. He sort of lived over in that beautiful building. It's a very beautiful building. To me, one of the most beautiful buildings actually in the world, and he's gotten to know it, Steve, very well. So if we could have a little update, Steve, would be fantastic as to how we're doing and what it's looking like. Thank you.
Thank you very much, Mr. President. And first, let me say, I would like to thank Mitch McConnell for his leadership, and I'd also like to thank Chuck Schumer for the enormous bipartisan support we had on this bill, and the many senators, both Republicans and Democrats, that worked tirelessly over the last 5 days on all the task force. As the President said, I got to live in the LBJ room for the last 5 days, and we couldn't be more pleased with the unprecedented response from the Senate to protect American workers and American business in this situation. The President has outlined many of these, but let me just quickly go through them. Again, small business retention loans. This will cover roughly 50% of the private payroll in small businesses, where we will immediately make loans that will supply 8 weeks of salaries as long as they keep workers employed and overhead. And those loans will be forgiven at the end of the period as long as they keep workers employed. These are SBA loans, but the Treasury will be issuing new regulations authorizing almost every single FDIC-insured bank to make these. I expect by the end of next week, we will have a very simple process where these can be made and dispersed in the same day. So this will be a very simple system to get money into small business hands. For companies that don't qualify that, we have a economic program of tax incentives to retain workers. And as the President said, we have enhanced unemployment insurance for people who don't fit into these two programs that will be administered through the states. We also have economic impact payments. These will be within the next 3 weeks, direct payments into most people's deposit accounts. And for those that don't have it, we will be having the checks in the mail. Treasury will have additional authorities. We have $500 billion that we can use to work with the Federal Reserve for emergency programs that will create up to an additional $4 trillion, if needed, to support American business and American workers in an unprecedented way. And then finally, the President mentioned $100 billion to hospitals and $150 billion to states that have specific coronavirus expenses, as well as many additional things. Mr. President, I especially want to thank you and the Vice President. You were constantly available to us. We spoke constantly throughout the day. You gave us guidance and quick decisions on many issues. And again, thank everybody for this great bipartisan work. This is going to be enormous help for the American workers and the American economy. The President was very determined that Congress would move swiftly to protect hardworking Americans in business in this unprecedented situation.
Thank you very much, Steve. Great job. Day and night, right? Day and night. That was a lot of work, and we'll see how it all goes. We still need a vote, Steve, don't we? And do you have a question? Yes.
Do you think this bill will keep the economy afloat?
Hopefully a long time. We'll see. If we have to go back, we have to go back. We're going to take care of the American worker. We're going to take care of these companies that fuel this country and make the country great. It's not their fault. It's not their fault. But we think
I would say we've anticipated 3 months. Hopefully we won't need this for 3 months. Hopefully this war will be won quicker. But we expect that this is a significant amount of money, if needed, to cover the economy.
And don't forget, a lot of this is going to be to keep companies that are very strong, AAA-rated companies previously, to keep them going. and it's going to be in the form of loans, so the money's going to come back. A lot of this money's coming back.
Separately, let me ask you about something you said yesterday. You said we should never be reliant on a foreign country for the means of our own survival.
Yeah.
What did you mean?
Well, I've
by
been saying
that?
that for a long
Is that-
time. Well, we're reliant on many countries where we give up our supply chains, we give up our factories, we give up our production facilities, and we can buy it someplace else for a little bit lower price. But it's really costing us more when that happens because we lose jobs, we lose everything, and we lose our independence, and we can't let that happen. So we'll be making some changes. We have been making those changes.
Is there an executive order to basically ban the export of medical equipment?
I don't know that we'll need that, but I think it's happening by itself. I think a lot of things are happening. Well, some people, we make the best medical equipment in the world, and you have some people like the European Union, they don't take it because they have specifications that don't allow our equipment in because it's designed in a different way. Even though it's a better way, it's designed. They're all playing games against us, okay? They've been playing games against us for years, and no president has ever done anything about it. But the European Union, you look at medical equipment, we make the best medical equipment in the world, but we can't sell it because, or not appropriately. And yet we take their medical equipment in our country. We're changing things, Steve. All this is changing. But they have specifications so that our equipment, designed specifically so that our equipment can't come into their countries. It's a very terrible thing that's happened to our country. And let me tell you, some of the people that took the biggest advantage of us are allies. You know, we talk about allies. They took advantage of us in many ways, but financially as well as even militarily. When you look at, if you look at NATO, the abuse that was given to our country on NATO, where they wouldn't pay. And we were paying for everybody. We're paying. Now, because of me, they're paying a lot. Now they've paid $135 billion more. And then ultimately, Secretary General Stoltenberg, who I think you would say is maybe my biggest fan, we got him to pay an additional $400 billion, other countries. And but you know that, and then there's the trade. They make it almost impossible for us to have a fair deal. They know this. They know I'm just waiting. We have all the advantages, by the way. It's going to be easy when I decide to do it. But this isn't the right time to do it. But we've been treated very, very unfairly by the European Union.
Mr. President, 4 Republican senators have indicated that the extra $600 for unemployment insurance may encourage workers to leave their jobs, even though you can only collect unemployment if you're fired. I'm curious what you think of that concern.
Well, I know the issue very well. We talked about it just a little while ago. Steve, I'm going to let you maybe discuss that.
Sure. Now, the President and I spoke to several of those senators today, but let me just explain the issue, which is we wanted to have enhanced unemployment insurance. Most of these state systems have technology that's 30 years old or older. So if we had the ability to customize this with much more specifics, we would have. This was the only way we could assure that the states could get money out quickly in a fair way, so we used $600 across the board. And I don't think it'll create incentives. Most Americans, what they want to keep their jobs. And I said for 50% of these businesses, they will have the businesses keep those jobs. So this was, our number one issue was how do we make sure that American workers who needed to keep getting paid, this is no fault of their own, that businesses have been shut down. The president and vice president wanted to make sure those hardworking Americans got money, and this was the most efficient way of doing it.
Senators that you spoke with, are they in agreement now?
I'm not going to comment on the specifics of where they are, but I would say, our expectation is this bill passes tonight and gets to the House tomorrow, and they pass it. We need to get this money into the American economy and American workers. That's the importance of this.
Yeah, the one good thing when you think about that, people are going to get actually more money, but we don't want to give a disincentive. But they have been talking about that. It's a good question, actually. Yes, ma'am, please.
Yes, thank you. The family of, on another subject, the family of retired FBI agent Robert Levinson says that
U.S. officials have concluded that he's died in Iranian custody. Are you aware of that? And how did U.S. officials reach that conclusion?
I've been very much involved in that. And he was a great gentleman and a great family. It's just, I mean, I have to say this, and they've been making the statement to the family, I believe, but it's not looking good. He wasn't well for years anyway in Iran. It's not looking promising. We've gotten so many people back. We got 2 people back this week, but Robert Levinson, who was outstanding, he's been sick for a long time, and he had some rough problems prior to his detainment or capture, and we feel terribly for the family. But
do you accept that he is dead?
No, I don't accept that he's dead. I don't accept it. I mean, I'm telling you, it's not looking great, but I won't accept that he's dead. They haven't told us that he's dead, but a lot of people are thinking that that is the case. Feel badly about it.
Mr. President, you tweeted earlier linking the closing of the country to your election success in November. Is this Easter timeline based on your political interests?
What do you mean by my election success? No.
You tweeted, you said that the media wants the country to remain closed to hurt your odds
No,
of
I
being
think the
reelected.
media, the media would like to see me do poorly in the election. I think
lawmakers and economists on both sides of the aisle have said that reopening the country by Easter is not a good idea. What is that plan based on?
Just so you understand. Are you ready? I think there are certain people that would like it not to open so quickly. I think there are certain people that would like it to do financially poorly because they think that would be very good as far as defeating me at the polls. And I don't know if that's so, but I do think it's so that there are people in your profession that would like that to happen. I think it's very clear. I think it's very clear that there are people in your profession that write fake news. You do. She does. There are people in your profession that write fake news. They would love to see me for whatever reason, because we've done one hell of a job. Nobody's done the job that we've done. And it's lucky that you have this group here right now for this problem, or you wouldn't even have a country left. Okay, go ahead,
Mr. President, 2 questions. The first one, once you sign the $2 trillion package, how soon or how rapidly do you expect to see economic growth?
Who are you with?
I'm with CBN. And my second question is, we are hearing you are pushing for April 6th to have direct payments issued to taxpayers. Is that the target date?
I think it's
Again,
very much.
I would say our expectation is within 3 weeks, we will have direct payments out where we have depository information. And we're looking to get a lot more information, and we have procedures to do that. So 3 weeks for that. And I would say the end of next week, we want all the banks to be able to originate loans same day.
Thank you, Mr. President. I have 2 questions for you. One is that tomorrow you're going to be speaking with the G20 leaders, and I want to know if you're going to lead an effort to craft a worldwide ban on wild animal markets so as to prevent another pandemic, given that COVID-19 is a zoonotic that was transferred to humans in trade of exotic animals.
Yeah, I don't know that subject's going to come up. There is a lot of talk that that's how this all happened, came out of China, and they say that's how it happened in China. So it's something maybe will be talked about, but it's not the top of my list.
Yes,
I think we're going to have a very good conference tomorrow.
Well, and to follow also, and Dr. Ashish Shah, who's the head of Harvard's Global Health Institute, says that the key to getting this economy open as soon as possible is to test everyone who needs testing so we can quarantine all infected individuals and allow everyone else to go back to work immediately. Would you subscribe to that strategy?
No, but we have tested more than anybody. I saw him.
And if not, how many deaths are acceptable?
Yeah. How many? None. Okay. How many deaths are acceptable to me? None. Okay, none. If that's your question. Look, I saw him. I saw his statement. We have tested by far more than anybody. We're testing more than anybody right now. There's nobody even close. And our tests are the best tests. They're the most accurate tests. But if you're saying we're going to test 350 million people, I watched his statement. I disagree with it. We can go to certain states. I could name them now, but I'm not going to do that. But we can go to certain states right now that have virtually no problem or a very small problem. We don't have to test the entire state in the Middle West or wherever they may be. We don't have to test the entire state. I think it's ridiculous. We don't have to do it. A lot of those states could go back right now, and they probably will, because at some point in the not-too-distant future, certain states are going to come off the rolls. Maybe New York can't, and maybe California can't. Maybe the state of Washington can't, although if you look at them, their biggest problem was in one nursing home. Yeah, go ahead.
But the states aren't silent. And so, I mean, somebody, if you test one state and then the person moves over to the other state, well then...
You know, you're going to just look at that. But if you take a look at the states, and many states that I'm talking about, they don't have a problem. We have some big problems, but it's confined to certain areas, high-density areas. So why would we test the entire nation, 350 people? With that being said, I'm going to say it again. We tested far more than anybody else. We have the ability to test. I mean, we've come a long way from an obsolete, broken system that I inherited. We have now tested, with the best test, far more than anybody else. And when I say anybody else, I'm talking about other countries. No country is even close. They came out with a statistic, I guess, yesterday that I heard from Dr. Birx, where it's for eight days here, more than 8 weeks in South Korea. And South Korea's done a good job. But we did in 8 days more than South Korea did in 8 weeks. That's a big number. And we're getting, I said before, exponentially better. Every day it's going up substantially. We have an incredible apparatus built now. But no, I don't want to test 350 million people. I think it's ridiculous. Yes, please.
Thank you so much, Mr. President. 2 questions. One follow-up on the G20, because the UN asked the G20 countries to do for more resources, for a coordinated stimulus package, ban on tariffs, waive on sanctions to try to prevent what they call an apocalyptic pandemic. Would you consider those measures? And
with respect to what?
On tariffs, and also related also to waive tariffs, and also
Look, we have strong
sanctions.
borders. Yeah.
And would you consider to join this global effort?
So before I came here, we weren't into borders. We had a country, people could come in. We had a whole different deal. Now we're up to almost 164 miles. Think of that, 164 miles of wall, big, beautiful wall. And in those areas, it's very, very tough to come in. We've been very tough on the borders. I mean, where we have the wall built, nobody's getting through. Now, they're going around, but that's a long trip. They're going around. That's the way they get through. But, no, I'm very strong on borders, and I don't want people coming in here. What I want is, if they're going to come in, they have to come in legally. They have to come in through merit. We're not having the people that you're talking about come into our country. All right.
Thanks, sir. Question for you and then for Dr. Fauci, if you'll let me. Both Republican and Democrat packages of the stimulus included $25 million worth of funding for the Kennedy Performance Arts Center here in Washington, D.C. Shouldn't that money be going to masks, respirators?
Well, I'll tell you what, I approved that. And I knew it was $35 million, and we actually took off 10. But I'm a fan of that, although I haven't spent time there because I'm far too busy. I'd love to go there evenings, but I'm too busy doing things because that's more important for me than going there. But the Kennedy Center has suffered greatly because nobody can go there. It's essentially closed. And they do need some funding. And I said, look, that was a Democrat request. That was not my request. But you got to give them something. It's something that they wanted. You know, it works that way. The Democrats have treated us fairly. I really believe that we've had a very good back and forth, and I say that with respect to Chuck Schumer. I spoke to him a number of times. But, you know, they had requests also. So that was a request. There were 35, as you know, and it came down to 25. We got it down to 25. We agreed. I said, that's a lousy soundbite. That's not a good soundbite, but that's the way life works. With that being said, the Kennedy Center, they do a beautiful job, an incredible job. David Rubenstein does a fantastic job. He's very much involved, and he puts up a lot of money, and he does things that a lot of people wouldn't be able to do or do. But they've been essentially closed. They have tremendous deficits that are built up. I mean, this thing has been devastating to it. So I didn't have a big problem with it. But this was a request from the Democrats because of the fact that they have a facility that's essentially closed up.
Yeah. Another question, sir.
In other words, you couldn't go there if you wanted to. If I wanted to go there tonight to look at Romeo and Juliet, I'd love to see Romeo and Juliet tonight, right? You know what would happen? They say, sorry, 250 people or 50 people, whatever it might be down to. Go ahead.
And then earlier today, Senator Marco Rubio told RCP that, quote, the World Health Organization showed favoritism to China, unquote. And then Representative Michael McCall, the ranking member on the House Foreign Relations Committee, he questioned the integrity of the World Health Organization's director, saying, quote, that there were several red flags in his past with respect to his relationship with China. Do you agree? Do you think the World Health Organization showed favoritism? And then once all the dust settles, do you think that the United States should re-explore its relationship with the World Health Organization?
Well, I think there is certainly a lot of talk that has been very unfair. I think that a lot of people feel that it's been very unfair. It's been very much sided with China. And a lot of people are not happy about it. At the same time, Dr. Fauci and myself and other people, there are people on there that we like and we know. A lot of, I think your friends are on there, a lot of good people, a lot of good professionals. I don't know, it'd be interesting to hear if you'd like to talk about the World WHO. But the fact is that I have heard for years that is very much biased toward China. So I don't know. Doctor, you want me to get you into this political mess?
No, I don't want you to do that, but I will. Tedros is really an outstanding person. I've known him from the time that he was the Minister of Health of Ethiopia. I mean, obviously, over the years, anyone who says that the WHO has not had problems has not been watching the WHO. But I think under his leadership, they've done very well. He has been all over this. I was on the phone with him a few hours ago leading a WHO call.
Transparency, sir?
No, I'm not talking about China. You asked me about Tedros.
The World Health Organization praising China for its transparency and leadership on their response to the pandemic?
You know, I can't comment on that because, I mean, I don't have any viewpoint into it. I mean, I don't even know what your question is.
Can I follow up on that phone call, please? Welcome to the group. You know, let me just tell you, I've heard that for years. I spoke to him yesterday. Seems fine to me. I don't know. But we're the ones that gave the great response, and we're the ones that kept China out of here. And if we didn't do it, you'd have thousands and thousands of people would have died, that are now living and happy. If I didn't do that early, call on China, and nobody wanted that to happen. Everybody thought it was just unnecessary to do it. And if we didn't do that, thousands and thousands of people would have died, more than what's happened. So that's it. All right, maybe one more. Steve, go ahead.
When you have this G20 meeting tomorrow, what sort of coordinated response are you expecting?
We're going to have a meeting with the 20 nations total, including us, and it'll be a conference call tomorrow morning sometime. I look forward to people I know, I like. I think in every instance, I like every one of them. But it'll be an interesting call. You'll be the first to know.
Next week, when the 15-day period ends, what should we expect then? Are you going to extend it for another
week? We'll be
or
talking.
two?
I'll be speaking. I'll be speaking with Tony. I'll be speaking with Deborah. I'll be speaking with some of the people that they like and respect, and they're going to bring along with them. We'll be speaking to Vice President Mike Pence and Steve, and we'll be speaking to everybody. I'm not going to do anything rash or hastily. I don't do that. But the country wants to get back to work. Our country was built to get back to work. We don't have a country where they say, hey, let's close it down for 2 years. We can't do that. It's not our country. So we're going to be talking, and it could be we'll do sections of our country. There's big sections of our country that are very, little affected by what's taken place. Then there are other sections that are very heavily affected. So there's a big difference. But no, I would say by Easter we'll have a recommendation, and maybe before Easter, and at the end of the 15th day, or even during the 15th day, I think we'll have some kind of a recommendation. But our country wants to get back to work, Steve. I have had so many people, and they want to practice social distancing, and they want to practice no handshaking. No handshaking. They're not going to walk around hugging and kissing each other in the office when they come back, even though they may feel like it. They're going to wash their hands more than they've ever done. They're going to do all the things you're supposed to do. But Steve, you know what? It's time. People want to get back to work. I get it from both sides, in all fairness. And maybe it's a combination of both. Tony said before, a combination of both is sometimes very good. But there are areas that possibly, probably, they won't qualify. There are other areas that qualify almost now. So we're going to have to see what happens, but it'll be an interesting period of time. I'd like to get our country back. I have tremendous numbers of people wanting to go back. You have store owners where the store is sitting there. They don't know what's happening. They got to get back. You have businesses that are going to be closed. The longer we stay out, the longer we do it, we want to go quickly. The longer we stay out, the harder it is to bring this incredible, we were having the most successful years that we've ever had in the history of our country. You saw what happened yesterday with the stocks, and today they're up. I'm telling you, if Steve gets the deal done, the incredible incentive deal is going to take care of people. It's going to take care of our workers. It's going to take care of companies that employ all these workers, small and big. By the way, I would say we spend more time on the small companies, Steve, than we did on the big companies. You know, people ask about that. We spent more time thinking about the small businesses than the big, and that's, but you know, that really fuels our country. We want to get back, and the people want to get back. We want to get our country going again, and we'll be able to do that. So, Vice President's going to stay with you, and going to take a few more questions specifically, and I will see you tomorrow. Thank you very much.
A question for you on the DPA, Mr. President. Mr. President, a question for you on the DPA.
Well, thank you all. A report on today's action by the White House Coronavirus Task Force. The President and our entire team continue to be inspired. By the way, people all across this country are putting into practice 15 days to slow the spread. We are 10 days into the 15 days. And let me say again to every American, if you're in an area that's been impacted by the coronavirus, it's absolutely essential that you listen to state and local authorities for guidance. But for every American, what you can do is implement the practices outlined in the President's coronavirus guidelines today, because we truly do believe that, as millions of Americans have done and will continue to do, that we can significantly impact the rate of growth in this epidemic in our country. We can spare Americans from exposure to the coronavirus, and we can save lives. And so on behalf of the President and our entire task force, I want to say thank you to the American people. Thank you for your cooperation. Thank you for embracing the principles in 15 days to slow the spread. We heard about that cooperation today in a series of conference calls. We spoke with equipment manufacturers who are stepping forward as never before to assist us in developing the medical equipment that is essential, whether it be masks or other medical supplies or ventilators. FEMA reported to our task force today that hundreds of companies have stepped forward to be involved in the supply chain, and we are vetting nearly 70 of those countries for specific repurposing of their manufacturing to produce everything from masks to gloves to gowns and, of course, to ventilators. We also had a very productive call with Secretary Betsy DeVos with education leaders from around the country today. And let me say on behalf of the President and a grateful nation, thank you to all of our teachers, many of whom are now home, teaching children from afar, even in many cases while they have their own kids home from school. You are truly heroes. And the Department of Education, as well as your State Department of Education, are grateful to each and every one of you who find yourselves educating out of home. And the Department of Education has a helpful website on coronavirus recommendations, ed.gov/coronavirus. And as we mentioned before, Secretary Betsy DeVos and Secretary Sonny Perdue will be joining us at this podium on Friday to speak about distance learning recommendations that have been made not just for secondary or for college education, but also for K through 12 education. We're opening up avenues, creating new flexibility so that not only college students can continue to be involved in learning from afar, but children K through 12 can do the same. Secretary Perdue will also be here to talk about the food lunch program and free and reduced lunches. Today, the President and I also spoke to over 150 CEOs of the top nonprofit organizations in the country. We thanked them for their ongoing work supplying the needs not only of people impacted by the coronavirus, but the most vulnerable among us in our communities. Organizations like Red Cross, the Salvation Army, Feeding America are all still working every day. And we promise to urge every American, if you have the means and have the ability, continue to be generous to nonprofit organizations that are helping those most in need in your community. The President marshaled a whole of government approach. That means working with our governors today. The President and I were in direct contact with governors of New York, California, Washington State, New Jersey, Michigan, and others. And we continue to be inspired and impressed by the leadership that governors are providing in their states, making tough choices, leading their states, and the President and I are truly grateful. The task force made a recommendation, and FEMA has assembled a team to provide technical assistance to the state of New York, and that team was welcomed by Governor Cuomo. Will be arriving on the ground there very soon, along with all the other resources that the President recently announced would be flowing to New York and to Washington State and to California. In my conversation with Governor Gavin Newsom of California, I was pleased to speak to him and hear that our FEMA team is literally at the table with the state of California's team, working to meet their supply needs, working to work on capacity. And I want people to know in the states that are most impacted by the coronavirus that we are with you. We're going to stay with you. We're going to continue to work around the clock to make sure your courageous healthcare workers, your health systems, and your state governments have the resources to support your response. On the subject of testing, Dr. Birx will reflect on what the data is showing in just a moment. Not including local labs and hospitals, we are at 432,000 tests completed. And we're pleased to see that there are literally drive-through and community sites around the country, and the U.S. Public Health Service is assisting states in standing those up each and every day. We do remind hospitals and labs around the country, and the moment the President signs the bill, that it is absolutely essential that they provide the results of the test to us. It gives us visibility into what's happening on the ground. But because of the public-private partnership President Trump initiated with these vast commercial lab networks around the country, we are adding tens of thousands of tests every single day. On the subject of supplies, before the end of the week, we'll talk a bit more, as the President did moments ago, about the supply chain. I was at FEMA last night and literally saw a room full of people with laptops and cell phones. We are literally leaving no stone unturned, as I told governors today, to find medical supplies, whether it be masks or gowns or gloves or ventilators, and the team is working around the clock to meet those needs. A few smaller items. First and foremost, the CDC is developing guidance, which we'll be publishing tomorrow, about the best way to utilize our natural resources at our parks. It would be several weeks ago that our Park Service waived all entrance fees, and we directed the CDC to produce guidance for how people can still practice social distancing and common sense, but be out of doors and enjoy our natural parks. We'll also be sharing that guidance with the vast state park systems around the country and encouraging their support. With that, let me last say again, there's nothing more important for the American people to do to slow the spread than to heed your state and local guidance in areas impacted by the coronavirus, and for everyone else to put into practice the 15 days to slow the spread. Dr. Fauci will reflect on the importance of mitigation and the impact that we believe that it is having around the country. But it is, people ask me from time to time, what can I do? And I say from my heart to every American, this is what you can do. Not just to protect your own health and that of your family, but no American wants to inadvertently spread the coronavirus, particularly to those that may be vulnerable to serious health consequences. Remember that the risk of serious illness to the average American remains low. I mean, the vast majority of people that contract the coronavirus will have mild symptoms to flu-like symptoms, and will recover. But for seniors with serious underlying health conditions or with people with immunodeficiencies, everyone needs to practice the principles of 15 days to slow the spread. The President announced this week that we are looking forward to the day that we can open up the country. And this team will be bringing him recommendations about how we can safely and responsibly do just that. But for every American that wants to see America back in business, you can hasten the day by putting into practice the 15 days to slow the spread. Go to coronavirus.gov for details. And I truly do believe if all of us will do all that we can do, we will slow the spread, we will protect the most vulnerable, and we will heal our land. With that, let me recognize Dr. Tony Fauci to speak about, Dr. Birx, please, and then Dr. Fauci. Thanks, Deb.
Thank you, Mr. Vice President, and thank you all for listening to us talk to the American people. We've been watching the testing results. It's very critical to us. It's very critical to be looking at that very carefully. Let me tell you two things that are going on in parallel. Our system to look at flu-like illnesses is still up and running in county after county and state after state. And why is that important? For those of you who've been following the flu epidemic this year, you'll remember we had flu A, then we had another peak of flu B, and those systems that are in every single state and local government is the platform where we can see whether there's any increase in flu-like illnesses. So if you have very few cases in your state and in your counties, maintain your flu surveillance system that you work closely with the CDC on, and look for changes in your slope of new flu-like illnesses. And there are enough test kits, and there's particularly enough of the CDC test kit where we started that runs on your flu surveillance platform to be constantly surveilling what those flu-like illnesses are in our states and counties that have very low number of cases. We have counties still with 0 to 1 cases, but they can participate in the surveillance that we need to have out there now by using their flu-like surveillance system, and we thank all of the states who have that up and running. If you go to cdc.gov and go to flu surveillance, you can see state by state, and you can be looking at those curves with us. It's what we're looking at day by day, in addition to the testing results that are coming in. For the testing results, still, there's 4 counties that constitute the majority of both the current cases and new cases. I think you know those are New York City, Westchester, New York, Suffolk, and Nassau County. Those are the 4 counties, all associated with New York and the New York metro area. There's a few counties in New Jersey, but this is still where 56% of the cases are and 56% of the new cases. It's very important that people look at the number of new cases per day. Remember, we told you it was going to take us a while to work through the testing backlog. I think we're close to working through the testing backlog so that you can interpret the number of cases per day, and you will see in New York City that the number of cases per day has been relatively constant over the last 3 days. Those are the number of new cases per day. This is a real call to every person in New York City and the New York metro area to continue every one of these 15 days to slow the spread, and to do that part of it at the same time that they're following the mayor's and governor's piece. Yesterday, we talked about people that may have left the metro area that were residents of the metro area that may have gone to secondary homes or other places to reside. And we've asked all of them to carefully monitor their temperatures and self-isolate from the communities where they went, just to ensure their own health and the health of their communities while people move around the country. Finally, why this is so important. It's very important to me personally because my grandmother, for 88 years, lived with the fact that she was the one at age 11 who brought home flu to her mother, named Leah, for which I am named, when her mother had just delivered. And her mother succumbed to the great 1918 flu. She never forgot that she was the child that was in school that innocently brought that flu home. This is why we keep saying to every American, you have a role to protect each and every person that you interact with. We have a role to protect one another. It's why we are social distancing and you are social distancing. But to every American out there, when you are protecting yourself, you're protecting others. And if you inadvertently, I know, brought this virus home to someone with a pre-existing condition, I can tell you my grandmother lived with that for 88 years. So this is what we're trying. This is the message that's important to everybody. This is not a theoretic. This is a reality. You can see the number of deaths that are occurring. We all have a role in preventing them. So thank you for the work that you do to get our message out to others, to really ensure that every American understands how important their role is as we move through these next 5 days, to not let up for an instant. I hear some reports that someone said, oh, well, the new cases in New York are increasing, or the hospitalizations are increasing. The number of new cases over the last 3 days have been consistent, but not rising any more than a consistent day-over-day rise. You will see hospital cases continue to increase because they are a reflection of what happened 1 to 2 weeks ago before the full mitigation efforts were put into place. So each person in every place, no matter what county, what community, what state, can work with us to ensure that we prevent the spread of this virus to others. So thank you.
Thank you, Mr. Vice President. I just want to spend a couple of minutes telling you a little bit about some information that I got on our weekly call that we have at least once a week with the WHO, which is led by Dr. Tedros and Mike Ryan, who's the point man there, to give us some information. And in that regard, I want to apologize for my curt response to you when you asked me about the China deal, because I shouldn't have done that. That's not my style. But what I really wanted to say is that my job is that I'm a scientist, I'm a physician, and I'm a public health person, and I don't like to get involved in that stuff. So anyway, getting back to the WHO. So we learned some really interesting information, because obviously the other countries like China and others had been hit prior that we did. One of the things that was striking to me, and I just throw it out because it's something that we will face. We're not facing it now, but we will face. Our Chinese colleagues are very concerned because they went through the entire cycle of the curve to come down. And they have very, very few cases. But what they're starting to see as they're relaxing the constraints on travel, that they're getting imported cases. And they wanted to warn us that when we get successful, make sure you very carefully examine how you're going to release the constraints on inputs. So I know we're going to be successful in putting this under control, but I think we're going to have to remember we don't want to import cases in. That's the first thing for today. The second thing that was important is that it was something that Dr. Birx mentioned, and that is when you look at the inflection of the curves, we now have multiple different countries that have gone through various phases of their individual outbreaks. And you could learn something from them about where you are in your own outbreak. For example, when China went up, what happened is they just didn't turn around. They went from going to, I'll just take an arbitrary number, 500 new cases a day. The next day it was 1,000 cases, then 1,500, and then 2,000. But once the number of new cases each day starts to flatten out, that's when you get to that point where the inflection goes down. So if what things we want to look for, the things that Dr. Birx had mentioned, that doesn't mean you declare victory when it does that, but you know you're at least on the way to where you want to go. And I think that's really very important. The third and final thing that I think gets back to the question that many of you in the audience have asked of us is about, would this possibly become a seasonal cyclic thing? And I've always indicated to you that I think it very well might. And the reason I say that is that what we're starting to see now in the Southern Hemisphere, in Southern Africa, and in the Southern Hemisphere countries is that we're having cases that are appearing as they go into their winter season. And if, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. What does that mean for us in what we're doing? It totally emphasizes the need to do what we're doing in developing a vaccine, testing it quickly, and trying to get it ready so that we'll have a vaccine available for that next cycle. In addition, to do the randomized controlled trials of drugs so that we will have a menu of drugs that we have shown to be effective and shown to be safe. Because I know we'll be successful in putting this down now, but we really need to be prepared for another cycle. And what we're doing, I believe, will prepare us well. Thank you.
Thanks, Doc. We'll take a few questions, please.
Mr. Vice President, on ventilators, some really important reporting from the Center of Public Integrity today. They suggested that there's only 16,000 in the national stockpile. Can you just give us some clarity? How many ventilators do you have in the national stockpile? Who else is making them, and how long will it take for them to make a critical mass? Because based on the Center for Public Integrity, it appears there aren't enough if people are going to die as a result.
Ventilators has been a singular focus of a good portion of our supply chain stabilization task force at FEMA since the President stood up FEMA's National Response Center. And we're making progress in a variety of ways. First, there is the national stockpile, which you refer, and depending on what's been distributed, we just delivered 4,000 ventilators to New York, including ventilators that we sent to New York City. But there's that number of some 20,000, less than 20,000. I won't dispute your number. Beyond that, there literally are, by most estimates, more than 150,000 ventilators in the broad healthcare system all across the country. We also, working with anesthesiologists, and there was a very important conference call today, we have determined several weeks ago that the devices that anesthesiologists use for outpatient surgery can be converted with the change of a single vent to a very useful ventilator. I actually spoke to Governor Cuomo about that today. He's in the process of surveying all of his surgical centers, as governors around the country are doing. We literally believe there's tens of thousands of ventilators that can be converted now that the FDA has given guidance. And Dr. Birx can probably speak to that in a moment. We actually have produced a helpful video to explain how quickly those devices can be converted. But we're also working with General Motors and other companies to immediately spin up production. Those contracts are being reviewed. We're vetting their capability. But one of the other ideas is, as we look at areas of the country that are most impacted, and now more than half of the cases for coronavirus are in New York State and in the region around there. But we'll want to focus our resources, including ventilators, on where communities are struggling the most with coronavirus. And so one of the ways that we're working through that at FEMA now is by spinning up production and at the same time working with the existing national supply, maybe from areas that don't have a particular burden yet with the coronavirus, and making sure that we're manufacturing, backfilling, and meeting that need. But what I can tell you is we've got an extraordinary team. Admiral Polovchek is a two-star Navy admiral who's doing an incredible job. We literally are identifying resources around the country and around the world. We're contracting and arranging transportation for those. But maybe Dr. Birx, you can speak to the ventilator, particularly the transition.
Thank you, sir. So I just want to thank Dr. Mary Peterson and the whole team of the American Association of Anesthesiologists, because they immediately, when we asked them, could these be modified, they went to immediate work on it. They're going to have Q&As up but more importantly, every anesthesiologist in every city has been working with their state and local health officials to really work with them how to change this. And I think that's not only the ventilators that they'll be supplying, they have the people that run those ventilators that are not any longer doing elective surgery. So changing that elective surgery piece over a week ago has freed up a lot of additional resources. When I talk to you about how we've done some things that are very horizontal across the country, but we're collecting data now in a county-by-county granular way. So it's like any epidemic, it's not equal everywhere. There are places that are very spared, and there's places where there's more. We have a very vast country with a lot of capacity and a lot of infrastructure. And so looking very specifically about where the virus has been, where is it going, who's got freed up resources from where it has been, because it didn't hit it hit Washington State earlier than it hit New York, and looking at all of those pieces to really ensure how we can innovatively move equipment around based on the need. And so I know that it has become a place where people are looking at numbers rather than what is needed. Because if you do these projections, when you got to those projections that said, like in Germany and others, that implied that 60% or 50% of the population would get infected, I want to be very clear, the only way that happens is this virus remains continuously moving through populations in this cycle, in the fall cycle, and another cycle. So that's through 3 cycles with nothing being done. And so we're dealing with the cycle A right now, not the one that could come in the fall of 2020, although we're getting prepared for it by the innovations that are being worked on, and not the 2021. We're really dealing with the here and now while we're planning for the future. And I think the numbers that have been put out there are actually very frightening to people. But I can tell you, if you go back and look at Wuhan and Hubei and all of these provinces, when they talk about 60,000 people being infected, even if you said, oh, right, well, there's asymptomatics and all of that, so you get to 600,000 people out of 80 million. That is nowhere close to the numbers that you see people putting out there. I think it has frightened the American people. I think on a model that you just run full out, you can get to those numbers if you have 0 controls and you do nothing. And we know that every American is doing something. And so I think what our job right now is to carefully detail on a hospital by hospital, state by state, county by county, to outline what the infrastructure needs are and ensure that we're meeting them, both from the stockpile and from the generosity and movement of the American people and other hospitals.
Dr. Burks, a lot of folks out there, well-intentioned, are sewing cloth masks and donating them to hospitals. So you or Dr. Fauci, can you weigh in on that? Because obviously these people have great intentions, but there's some mixed feedback on whether that's a good idea.
I'm sorry.
Better than nothing? Lots of surgical masks. People are sewing them. So clothing manufacturers, volunteers dropping them off at hospitals. Is that necessary? Is that helpful? Is it something you'd recommend?
Well, I mean, you would only recommend that under desperate situations if you don't have any mask. But what we're seeing now, as you've heard, is a rather significant inflow of masks that are coming in that are going to be available. I mean, obviously, if you don't have a mask and you need a mask and it's appropriate for you to be wear it, you do what you can. But I don't see that now as a necessity, given what's going on right now.
Great. Great.
Mr. Vice President?
We'll take a couple more. Thanks.
Thank you, Mr. Vice President. We keep hearing reports of competition among states that are trying to buy this necessary equipment on the private market. And the governor of Kentucky said yesterday that his state was in line to buy some equipment, but FEMA came in and purchased it from under them. So he says this is creating a real problem for states because on the one hand, they're being told to get the equipment themselves if they can, but on the other hand, the federal government is buying up the supply chain. So is this a problem that you're hearing about, and what is your advice to states like Kentucky that are having this issue?
I actually spoke to the governor of Michigan today, Governor Whitmer and I, about just that. And we put our FEMA regional representative right on the case. We want to make sure that we're acquiring every bit as much as we can through FEMA, but as we work with the supply chain, we want to have full coordination with the states and the requests they're making and hospitals that they're making, and we're looking into those matters. But make no mistake about it, this FEMA team at the President's direction is leaning into this effort, leaving no stone unturned. Literally searching not just the nation but the world for all these critical supplies. And as the President just reported to you, we're in the process of shipping 9.4 million N95 respirators, 20 million surgical masks, 3.1 million face shields, and the list goes on. And we're going to be shipping those every single day. But as I told Governor Whitmer today, who's leading her state through all of this with great energy, we want to partner with her. We want to partner with every governor and make sure that the left hand knows what the right hand is doing in terms of acquiring resources.
Mr.
How about
Vice
that?
Thanks, sir.
Or how about you right here?
Thank you so much.
No, right here.
Thank you.
Can I ask
Thank
the
you.
next one?
Go ahead.
On the mask question, people, healthcare workers on the ground still report that there are mask shortages. What timeline do you predict for making sure everyone who needs a mask is adequately supplied?
Well, I'm going to let Dr. Birx address that as well, but let me say again, I just received a report. We're going to be detailing it before the end of the week, where we've literally identified significant resources, not just around the country but around the world, of the masks that can be used by healthcare workers. But as Dr. Birx said, we are focusing those resources in the areas where healthcare workers are most exposed to the prospect of contracting the coronavirus. The President's made it clear from early on, right after seeing to the needs of Americans who are struggling with the coronavirus, making sure they have the support that they need on the same level of priority. We want our healthcare workers to have the personal protective equipment to be able to do their job safely, and we're working on that. I will tell you, I spoke about this today to several governors, not only the governor of Michigan, but the governor of Indiana, and President Trump and I couldn't be more grateful. The way governors around the country are joining us in calling on businesses to go back to their warehouses and identify industrial masks, N95 masks, that because of the change that President Trump insisted on in the law, can now be used by hospital workers. And they're perfectly acceptable to protect a healthcare worker from the possibility of a respiratory disease. But we're calling on, and our governors are joining us in calling on, every business across America during this time of a great challenge where many businesses are idled. Go back to your storehouses, identify N95 industrial masks, and as I told our governors today, they can call FEMA, they can call the state healthcare services, or they can just load them up on a flatbed and drive them over to their local hospital. And literally, we hear stories in every state in the union of people doing that. And so it's happening all at the same time, and we'll be detailing the progress we're making on masks. Anything further, Deb?
Thank you, Mr. Vice President. I just wanted to add one piece, and this is really a call to every state out there and every county that has been doing community-based testing. The FDA put out new guidance, we talked about it several days ago, that people can do self-testing in the drive-through, where you give them the materials to do it in their car, and you pick it up in a biohazard bag. This would free up all of that PPE that you see being utilized in those drive-throughs back to the hospitals and back to the clinics that need it the most. We have to move to the new technology. FDA worked tirelessly to get that out there so that it could be sparing of gowns and gloves and full respiratory N95s. This is the moment to move to that self-testing front of nose with the new applicators that can be utilized so that every single bit of the N95s can be put into the hospitals that need it.
Dr. Birx?
Mr. Vice
Dr. Vice President?
Let me just say we look forward to seeing you all tomorrow. We'll be back here with further progress and news. But if I could just say to every American,
Is he okay? You keep asking.
we'll get through this.
He keeps asking you if you're okay.
We'll get through this. But we'll get through this together. Every American needs to understand that whether you are in an area that's impacted by the coronavirus or an area where there's very few cases, if you do your part to put into practice 15 days to slow the spread, you will do just that. You'll impact the spread of this coronavirus epidemic in our country. These experts tell me that we can significantly reduce the number of Americans that would be exposed to the coronavirus as every American continues to put these guidelines into practice. And we just know that with all of the extraordinary effort that's being done at the federal level by this tremendous team in all of our agencies, all the great leadership by governors in both parties across the country, with all the incredible and courageous work by healthcare workers, with the cooperation and the prayers of the American people, we will get this done. We will We will not only slow the spread, we'll protect the vulnerable, and we'll heal our land. Thank you all. We'll see you tomorrow.
Thank you, sir.
Have to say now that this whistleblower complaint, the redacted version of it, is now out in the public record, and we will at that point later this afternoon, the members of that committee will have had a chance to ask all of their questions to these two men privately. Already, we've heard from people like Mitt Romney, who's talked about the allegations being troubling in the extreme, is the quote that he used. Pat Toomey, another Republican, saying that it's inappropriate, the president's behavior, leaning on a foreign leader to, in effect, do the dirty work of his political campaign. Savannah.
She had 2 copies. All right, Jeff, thank you so much. And we see Adam Schiff, the chairman of the House Intelligence Committee, who has now sat down with the witnesses in place. And so in a moment, we would expect to hear usually opening statements from the chairman and the ranking member. Let's listen in.
At any time. The presidential oath of office requires the President of the United States to do 2 things: faithfully execute his or her office and protect and defend the Constitution. That oath, of course, cannot be honored if the President does not first defend the country. If our national security is jeopardized, if our country is left undefended, the necessity to faithfully execute the office becomes moot. Where there is no country, there is no office to execute. And so the duty to defend the nation is foundational to the President's responsibilities. But what of this second responsibility, to defend the Constitution? What does that really mean? The founders were not speaking, of course, of a piece of parchment. Rather, they were expressing the obligation of the President to defend the institutions of our democracy, to defend our system of checks and balances that the Constitution enshrines, to defend the rule of law, a principle upon which the idea of America was born, that we're a nation of laws, not men. If we do not defend the nation, there is no Constitution. But if we do not defend the Constitution, there is no nation worth defending. Yesterday, we were presented with the most graphic evidence yet that the President of the United States has betrayed his oath of office, betrayed his oath to defend our national security, and betrayed his oath to defend our Constitution. For yesterday, we were presented with a record of a call between the President of the United States and the President of Ukraine, in which the President, our President, sacrificed our national security and our Constitution for his personal political benefit. To understand how he did so, we must first understand just how overwhelmingly dependent Ukraine is on the United States, militarily, financially, diplomatically, and in every other way. And not just on the United States, but on the person of the President. Ukraine was invaded by its neighbor, by our common adversary, by Vladimir Putin's Russia. It remains occupied by Russian irregular forces in a long simmering war. Ukraine desperately needs our help, and for years we have given it, and on a bipartisan basis. That is until 2 months ago, when it was held up inexplicably by President Trump. It is in this context, after a brief congratulatory call from President Trump to President Zelensky on April 21st, and after the President's personal emissary, Rudy Giuliani, made it abundantly clear to Ukrainian officials over several months that the President wanted dirt on his political opponent, it is in this context that the new President of Ukraine would speak to Donald Trump over the phone on July 25th. President Zelensky, eager to establish himself at home as a friend of the President of the most powerful nation on earth, had at least two objectives: get a meeting with the President and get more military help. And so what happened on that call? Zelensky begins by ingratiating himself, and he tries to enlist the support of the President. He expresses his interest in meeting with the President and says his country wants to acquire more weapons from us to defend itself. And what is the President's response? Well, it reads like a classic organized crime shakedown. Shorn of its rambling character and in not so many words, this is the essence of what the President communicates. We've been very good to your country, very good. No other country has done as much as we have. But you know what? I don't see much reciprocity here. I hear what you want. I have a favor I want from you, though. And I'm going to say this only 7 times, so you better listen good. I want you to make up dirt on my political opponent, understand lots of it. On this and on that, I'm going to put you in touch with people, and not just any people. I'm going to put you in touch with Attorney General of the United States, my Attorney General, Bill Barr. He's got the whole weight of the American law enforcement behind him. And I'm going to put you in touch with Rudy. You're going to love him, trust me. You know what I'm asking, and so I'm only going to say this a few more times, in a few more ways.